Jill, we should be good.
All right, let's call the meeting to order. Start with a roll call.
Commissioner Holmes.
Here.
Commissioner Irvin.
Here.
Commissioner Klein. Commissioner Krutoff.
Yep.
Commissioner Lancaster. Vice Chair Jameson. Chair Rhodey.
Here.
And please remember to turn on your microphones when speaking.
Right, the next item is approval of the minutes, but unfortunately they weren't attached, so we're going to table that and approve that next meeting. Approval of the agenda. Anybody have any questions or anything they want to add? I have an motion to approve the agenda.
Motion to approve.
Support. Okay, all in favor say aye. Aye.
Aye.
Okay. And you'll remember to put both those minutes on the meeting next time? Okay, thanks. Written communications, I don't believe we had any. We did? Oh. Okay. All right, so. Is it added to is it an agenda item or you, oh. So if we, so we had a new one and we clicked on that, we could see it. Okay. All right, we'll review that, and if there's any issues, we'll talk about it at the next meeting. Any comments or communications from the audience? Okay, good. Thank you. Not good. You could certainly comment, but thank you. Any communications from any committee members? All right. First item is we requested a presentation on current health insurance and how the process works, how they bid for it, and try to find the most beneficial plans. And we have Gallagher here to do that. Hi, I'm Jill. Hi.
All right. You all want me to jump in?
Please.
Does that work? Great. All right. Well, it's good to be with you all this evening. My name is Chad Hodkinson. I'm an area senior vice president with Gallagher, and I serve as the managing partner on your account from the Gallagher side. I also lead Gallagher's Michigan public sector practice. And so this is a lot of the work that we do. My team solely focuses on Michigan public sector groups and helping them with their health insurance programs. That includes a lot of things. Certainly want to recognize City Manager Bellman, along with Audrey and Emily from HR or finance and HR. They've just been great partners to us as we've, seek feedback from the city of what are they looking to accomplish and really carrying out their strategic objectives and partnering with them to make sure that we're doing all that the city is looking for as it relates to your benefit program. So we'll go through a market update this evening. We do have quite a bit of information to go through. There's quite a bit going on in the market. If you've been paying attention to the news, you'll see that it's a challenging time for healthcare in general, and employer health plans like the cities are experiencing that directly. So I'll drive through these slides as I go. Please feel free to ask questions. If there's anything that I'm saying that isn't clear or familiar, happy to bring clarification. And I think Audrey is going to click through the presentation as we go. And I believe it was all provided to all of you in your packet, so you're in good shape. Great. I'll just present off of the screen here. So we'll go through kind of your current plans and considerations. You all opted to join the pool, and I'll talk about what that is January 1st of 2025. And so you're just had your first renewal with the pool. We'll talk about Public Act 152 and potential changes to that and how that may or may not impact. We'll talk bigger picture, state of the market, some of the challenges and headwinds, as well as tailwinds that we're seeing, and then wrap up with a summary. And again, feel free to ask questions as we go. All right. So this gives you a current benefit overview here at the city from a medical and prescription drug, including your pre-65 retiree enrollment. you were enrolled in the Western Michigan Health Insurance Pool, which is branded as the pool. They did that several years ago. It was filed as the Western Michigan Health Insurance Pool in 2005. Anymore, there are member organizations from all over the state. So that's why they dropped the Western to not confuse folks. For your Medicare Advantage, for your post-65 retirees, that's offered through Humana. You have a health reimbursement arrangement that wraps some of those retiree costs down, and the city self-funds some of that. Those services are provided by diversified benefit administrators. And your dental is self-funded through Delta Dental. Your vision program is offered through National Vision Administrators, NVA. Life and disability is provided through the Standard. And then your flexible spending accounts are administered by Health Equity. All right, so that gives you just kind of an overview of the benefit package that city employees as well as pre-65s and post-65s are offered here at the city. All right. Before we dove into sort of more of the structure and what's going on in the market, we felt like it was important to talk about how health plan costs break down and different funding methodologies that are available to employer health plans like the city. So when we talk about health plan cost components, it really breaks down into two components: variable costs, which are claims that are incurred by city employees and their dependents, as well as retirees. We call those variable costs because claims vary month to month, week to week. And then fees and taxes and risk insurance, we refer to as fixed costs, because you pay premiums and administrative fees on a flat cost basis, and those don't change over a 12-month period. And you add those together, that's the total plan cost. And then the next slides show you how these costs can be funded by the employer to offer coverage for employees. So the first example is a fully insured example. And what this says is you're going to pay a flat single, two-person and family rate for a set plan design for the workforce. And whether you use more than the carrier expects or less, you're going to pay that amount for 12 months. And then they're going to give you a renewal. And the renewal is going to be based on how you utilized in the past to project what you're likely to utilize in the future. They're going to try to set rates to take in enough money to account for that expected utilization. And then you go for another 12 months. So it's predictable from a budgetary perspective. However, you're paying the carrier to hold risk on the behalf of the city, right? So there's added cost when you're fully insuring because you're transferring risk. The next slide takes you into an alternative model, which is self-funding. When you self-fund health insurance or any other benefit, you're paying as you go, meaning if you have a heavy claims week, you're going to get an invoice for more health insurance costs, right? Medical and prescription drug costs. If you have a lighter week, you'll get a smaller invoice. And you see that line graph, now you get some volatility there, right? You're actually paying as you go. Why would any employer ever do this? Well, when you pay actual costs, if you use less than expected over a year, that's money you're not sending to the insurance carrier. It's money you're keeping in the city's coffers. Now, if it happens the other way and you use more than expected, that's money that is coming out of the coffers, whereas in the fully insured realm, the carrier is covering that cost. But statistically over the long haul, self-funding should be more cost efficient than fully insuring. What you all are doing today is actually pooling to fund your health insurance costs. And that's on the next slide. And when we pool, we're actually sharing risk with other organizations. All right. So we'll talk a little bit more about who the pool is, but you're sharing claims costs and you're spreading that risk among a broader group of employers and a larger group of individuals. And you're doing that in hopes of gaining market leverage to negotiate those fixed costs downward. And you're also hoping to get added value in terms of the program elements and drive some stability as you're spreading out that risk across the broader population. We can go to the next slide, Audrey. So before we get into more of your current partner of the pool and who they are, We wanted to make you aware of two key pieces of legislation. The first is Public Act 106. This act was passed back in 2007 here in the state of Michigan. And what it does is it requires you all to go out to the market and bid your health insurance, your dental, and your vision once every 3 years, or when you make plan design changes to those lines of coverage. Ultimately, so we support this legislative requirement for you all, taking you out to market and making sure that you have the most competitive programs. And then ultimately, if there's an expiration of guarantees around premium, those kinds of things, we would take you out to market then as well. So that's Public Act 106 in a nutshell. Questions about that? We doing okay? All right, we'll keep rolling. And then this gives you a historical benefit change overview. So when we first engaged with you all, and that was back in 2019, you were with McLaren. If you'll recall, McLaren had a commercial insurance program. They have since closed that program. They shut that program down. And so in 2024, when that was shut down, we needed to find a new home for you, for your health insurance program. That's when you all joined the pool. And I said 2025, but it was actually, I guess July 1 of 25 was your first renewal. You're coming up on your second one here, July of 26. Your dental program, you used to be with a company called ADN. We moved you to Delta Dental when we found a better offer for you, July 1 of 2025. You used to be with VSP. We moved you to NVA in July 1 of 2023, and you actually expanded that coverage to all employees. We have a table summarizing that. We just moved you to the standard July 1 of 2025 from National Insurance Services. Again, found a market competitive offer there. And then flexible spending account and retiree wrap program used to be provided by a company called EBC. EBC, we inherited that. EBC went out of business. We moved you all to diversified benefits for the retiree wrap. We moved you to health equity for the FSA. So this just shows you some of the activity that we're engaged in with you all as a city. The comment was made about how we go out to market and helping you all evaluate the market to be sure you're in a competitive position. And then this goes through some gross costs for you. I'm going to flip to the page because some of the numbers get a little small for my 50-year-old eyes. So on the medical side, this just shows you historically where you were with the McLaren wrap and sort of what's happened with costs over the years. You can see the percentage increases on the right-hand side. Your initial pool increase was at 8.4% for 2025 when you, for your first renewal, in 9.1% July 1 of 2026. That's the renewal you will experience upcoming. That is official, yes. These renewals were the pool average renewals, and we can talk more about pool underwriting practices, but they calculate an average, a pool-wide average renewal. And then if you're performing worse than expected, okay, you're incurring more costs than the pool priced you at, they have a banding methodology where they can increase your renewal by bands up to a maximum of 3.75% off of the average. You all coming in at the average says you're performing about the same as the balance of the pool members, the 270 members. If you beat expectations, you're using less than the pool expected based on your premiums, they can also band you down in those same increments down to a maximum of 3.75 below the average. But again, you all are performing within 2.5% up or down of the pool average of 9.1, okay? For dental, you can see kind of what the historical increases were, a little bit of decrease, a little bit of increase. 1.9% on dental is actually really good. We've seen some higher than usual dental trends up to 6%. Vision, you can see that big jump in cost in 2024. That's when you opted to offer vision coverage to all city employees. That's why you saw that uptick in cost there. You're in a rate guarantee right now with your vision program through NVA, so no change there. You can see the move from NIS to the standard gave you an 18% cost decrease when you made that move, and you've been in a rate guarantee since, and the standard is holding those rates steady. So that's a good message there. And then Humana with Medicare Advantage. Yes, Jill.
Go ahead and finish.
Sorry. With Humana, you were really experiencing no rate change. And then we had a bit of a bump there with the Inflation Reduction Act and some of the impact that had on retiree healthcare. And we actually saw that come down 2.5 points in your most recent renewal for 2026. Please.
If for these retiree Medicare, if we did a regional cooperation and went out with 4,000 retirees, would it make a substantial reduction than if we go out with 200 retirees?
Yeah, so it's interesting that you say that. So the pool that you participate in for the active employees, we actually marketed the pool launched a pooled Medicare Advantage product. And we wanted to take a look at that alongside your standalone to see if there was any differential in rates. And what we found was there was no pickup there. What you'll find is just because you form a larger group in health insurance doesn't necessarily mean that'll drive lower costs. You can negotiate some things on the fixed cost side that can help. But what I always tell people is if you assemble a large group of expensive people, let's say, and I'm not saying that's what the city is, I'm just saying in general, then you've just got a big group of more expensive people. It doesn't make anything cheaper. They're using a lot of healthcare and we got to pay for that. And so there's a higher premium associated.
If the Lansing had 800 people, let's say, and the
Right.
county has 800 people and we have 200 people,
Right.
and we're all pretty much got the same plan.
Yeah.
You don't think there'd be substantial savings if we all tried to buy it together?
I mean, I will say it's hard to say without pulling the group together and then taking that specific group out to market. I think what I'm saying is just by the nature of it being a larger group, doesn't necessarily mean it would be lower cost. All right. Any other questions? Okay. And then the post-65 wrap program, you all can see sort of the fluctuations there. The anomaly with the 29% decrease really had to do with EBC going out of business and there being a delay in some of those wrap claims being processed, and then those catching up after the move to diversified benefit administrators. And so that's that little anomaly you see, but we would expect to see that continue to bump along. It's fairly stable. It's a lower cost in your overall healthcare spend, as you can see. If you totaled all this up, you all are about at $8 million annually in all-in benefit spend here at the city, including your retirees. All right.
Post-65 wrap,
Sure.
exactly what that means.
So when we talk about a wrap, what it's saying is the city had made contractual agreements to retirees at different points in time in history. And as you all changed your Medicare Advantage carrier and maybe the design of that Medicare Advantage plan, in order to honor some of the guarantees you had made to prior retirees, you contract with this administrator to say, okay, the base benefit might charge you a copay of X. The administrator, if you submit a claim for that copay, the administrator will reimburse you the difference between what was guaranteed to you when you retired and the current benefit level today. So it's in essence wrapping a less rich benefit down to a richer benefit, and the city is self-funding that gap. Does that help a little bit? Yeah. All right, we doing okay, everybody? All right, I'll keep rolling. Healthcare Task Force Committee. This is a committee that we support you all on. I think you all know you bring your union and non-affiliateds together for conversations around healthcare, and really the purpose is to stay educated on what's going on in the benefit landscape. This allows you all to make proactive versus reactive decisions with your stakeholders involved, providing legislative updates at both the national and state level. looking for, are there problem areas? It's a vehicle for feedback of how people are feeling about the benefit offering of the city and what opportunities do we have to address issues. Exploring and sharing options for change, looking at what renewals are looking at, what alternatives are coming back from the market, and then looking at potential future changes we can make. And finally, just instilling this sense of transparency and openness, right? We're going to talk about what's going on in benefits. There's nothing hidden here. Make sense? All right, a lot of words on these next 2 slides, so we'll try to work through these. Look at the reaction over here. Okay, so this is what I will tell you is there is a ton going on in the healthcare market space, and we'll talk more about this as we go. When we talk about things we can do to save money in healthcare, certainly plan design adjustments is one of those. And that can be things like increasing out-of-pocket exposure in the form of like deductibles or copays. You could look at high deductible health plans that are compatible with health savings accounts. That's been a popular move for a lot of public sector employers in Michigan. I mentioned copays and even looking at tiered networks, which means if really we begin to try to incentivize access at higher quality, lower cost facilities. And if someone is willing to use that facility, we'll charge them a lower out-of-pocket deductible. Then you could maybe go to a second tier with a facility that might be higher cost, not as good a quality outcomes. You can choose to go there, but you might have more out-of-pocket costs. So you're trying to incentivize directing care there.
That area as far as McLaren versus Sparrow?
That's a good question. I think there is variability there. I wouldn't be prepared today to speak to you about how the two compare specifically in terms of cost and quality. I think it would depend a lot on what you're accessing for, right, in terms of the procedure. And it would depend on, you know, even time frame for that matter. That's something I could certainly follow up on.
Sounds like a lot of work, but I mean, have you seen significant savings when you've looked at this for other communities?
Where the trend that we're seeing right now, and there is a slide later in the deck, is this concept of direct contracting. When we're in an environment we're in like right now with healthcare, where we're seeing a hyper escalation of healthcare trend, what you see is vendors come to the market and say, you know what, we think we can go and negotiate direct deals with a hospital system, with a doctor group, whatever the case might be, that are better than what the insurance carriers are able to do right now. Why would a hospital system agree to a lower reimbursement rate to a third party than they would an insurance carrier? Well, if the third party is guaranteeing them quicker payments, for instance, versus a longer wait for getting their dollars, that could be a motivator to say, okay, we'll agree to a reimbursement for a knee replacement that is 5% less than we've agreed to with this or that major carrier. No, we are the consultant to help you evaluate these types of options that are out there in the market, and also to look at, okay, what would this feel like to the workforce if we were to implement something like this? Because that's certainly part of the consideration, right? Is disruption, the quality of the experience, all of those things come into play when we're making these decisions.
That would be my initial thought, to tell employees they need to go to one hospital and not the other. I'm just not certain any employer would want to do that, especially a governmental entity. So that would be my only concern about looking forward on that.
When you talk about offering several plans to an employee, the legislation that's still held up in court and everything else, that says we have to pay 80% of the cost of the insurance.
Right.
Does that mean if they want to take a more expensive plan, we have to pay 80% of the difference? Or does it mean we pay 80% of the base cost? Or is that something that has to be determined?
It's what is being referred to as House Bill 6058, the proposed amendment to Public Act 152. Remember, Public Act 152, it caps the amount that public sector employers are allowed to spend on their employees' health insurance, okay? You all as a municipal entity have the ability under the act to opt out of Public Act 152, which the city has chosen to do at this time. House Bill 6058, if it were to become law, it does require then, it flips the requirement from a ceiling, you may not spend more than 80%, to you must spend at least 80%. And that is on the total premium of your program, okay? And so this is a concern with the piece of legislation for our clients who offer two plans side by side, and one is maybe a richer plan with more premium, and another is a less rich plan with lower premium. If you're having to pay at least 80%, you'll invariably see people migrate to that higher cost plan because the employer is bringing more money to the table. Why wouldn't they, right? And I've got some slides in here to talk a little more about 6058 and what it could mean.
Okay,
All right.
okay, thank you.
Oh, it's a great question. Anybody else? All right. Please keep the questions coming. I would almost rather that than talk at you all for an hour. Is this helpful the way we're going through this? Okay. Wellness and preventive care, you all incentivizing folks to be engaged with their healthcare. What we know is we can't manage a condition that we don't know about. And the more we have our health under management, the more that's going to protect our own pockets, our own wallets, our own quality of life, and the overall plan as well. So we do have some public sector employers in Michigan who incentivize their employees to engage with their primary care physician for their annual physical, for example. And we see a direct correlation to a reduction in healthcare, overall healthcare trend when we have a high degree of uptake on that. Network optimization, this really speaks back to what we were talking about earlier. So I've kind of already spoken to this. I won't go into more detail there. On the next slide, employee education and engagement. I just applaud the city's efforts around the committee, the task force. I think this is what you're doing through that environment. And also helping the broader workforce have access to things like cost transparency tools. Healthcare is one of the most opaque industries, right? Imagine if we went to the grocery store and we found out what our groceries were going to cost us once we went and scanned them at the checkout line. That's kind of how it feels with healthcare. We don't know what we're going to pay until the bill shows up. So more and more is coming to the table in terms of data to help us as consumers know what we're going to pay before we access the service. And then telemedicine, this is growing as well. And certainly it's less expensive to offer or to access care telephonically or virtually than it is in person, than it is for the ER and so on. So site of care matters. Dependent eligibility audits. This is really just checking the plan to see, is there anyone on the plan that actually isn't entitled to be on the plan? Maybe a child through an adoption order or a divorce situation, anything like that. Voluntary benefits. This is offering supplemental benefits to your employees that they can access on a payroll deducted basis out of their own pocket to maybe close some of the gaps that they could have with their health insurance program.
Lansing have that?
So today, you all are offering voluntary life, additional life insurance, but none of the other lines at this time, I don't believe. Yeah. And I guess I will say with that, right now, the healthcare program you're offering has a pretty rich benefit in terms of a deductible. There is a lower deductible than we standardly see. And so oftentimes when you're looking at some of these worksite benefits, it's designed to cover some of those potential out-of-pocket expenses. So we help evaluate that on a regular basis to see, would it make sense to offer these with your broader benefit program, okay? Analyzing your claims data, this is a way we partner with you all. This is all de-identified, of course, but again, the way the population is utilizing today influences what or indicates what future costs are going to be. And so we're always taking a look at that data and helping you all analyze it so you can anticipate what the likely future is going to look like versus waiting to find out and be surprised by it. That's an important element. And then I talked about wellness incentives earlier. You can incentivize folks to do a lot of things, biometric screenings or completing health risk assessments, fitness challenges, those sorts of things. And we've got some more information in here around those topics. The last page is just a commission disclosure, so you understand Gallagher's commitment to you all and every one of our clients is complete transparency with how we're compensated and what we're compensated. And so this shows you each line of coverage, who the carrier is, and the arrangement for Gallagher, whether it's a direct fee or a commission as a percentage of premium. And so we wanted to be sure to include that. This is something the city receives on an annual basis. And anytime we're helping you evaluate market alternatives, our commitment to you is you're always going to know how the dollars are changing hands. We're never going to recommend something to you all that isn't in your best interest. All right. All right. The next several slides dig in a little more to who the pool is, which you're a member organization of the pool today. Would it help for me to run through this briefly just to give you an understanding? You're good with the pool? Okay. We can just, is everybody good with that? We can just fly through these.
Is there something, is this the one that kind of shows where our experience is compared to, or is this just kind of the?
That's generic. Yeah, that's the generic one. Yep.
Did we write?
That's what the 9.1 indicates. That was the pool-wide average. Yep. Okay. Public Act 152, I gave you all sort of a brief overview there in response to the question about 6058. I think slide 29, if we can go forward one, is a really intriguing one. This indicates some of the challenge of PA 152 today is over the life of the bill being in existence, hard caps, which is the default position and where the city had traditionally been, the average was 2.7% increase on hard caps year over year. Healthcare trend has been much higher than that, right? And so if you flip if we go to the next slide, this is the picture that's created. That blue line is healthcare trend. The green line is hard cap increases. And that divergence out on the right-hand side is the cost that's been shifted to public sector employees as the hard cap increases has not kept up with healthcare cost increases. And this is really the driver behind the city's decision to opt out of PA 152. What I would say, you all, is PA 152 as it exists today doesn't seem to be sustainable for public sector employees. On the other hand, 6058, I think, creates some real challenges for public sector employers and their employees if things were to change. And we can talk about that a little bit more. Question?
Yeah, you were saying that the 80% is based on the total cost for the city.
Right.
So if we were to offer a more expensive plan, we could, in essence, offer that with a full cost delta to the employee.
It under PA 152, if it were to change by House Bill 6058, I mean, technically you could pay 100% of the cost then. You could pay as much as you chose to.
Well, we could pay 100% of the cost, or we could say that if an employee, for example, if the base price is $100 and you want to go to a $150 plan, we would not necessarily have to pay the additional 80% of that 50.
You
could say the employee pays the whole difference.
So
Bargain. Have to bargain for that.
Well,
Yeah.
but you see what I'm saying?
I understand, but
Yeah, we could.
we can't change what the employees pay without going through collective bargaining. Okay,
No, but I mean, it's a flexibility that it gives you in the bargaining process that you don't automatically have to pay 80% of every individual. You pay 80% of the overall.
yeah, I mean, I think the challenge with the model, with the example is if you didn't pay 80% of that higher cost of the plan, that higher cost plan, you'd need to pay a higher percentage of the lower cost plan so that in the aggregate, you are spending at least in total 80%. And so we'd have to dig into those numbers to understand,
No, I understand that.
yeah, the balancing act for sure. Yeah.
You get into those trade-offs trying to figure out what optimize. And it also depends how that influences individuals' decisions.
100%. That's a really important part. The way we price contributions for one plan design versus another is going to dictate choices that people make, and we need to price it appropriately for the design of the plan. If we underprice a plan, that creates a real problem for the program over time.
Right, and pricing a high deductible plan such that it makes it attractive for people who want to get an HSA,
Uh-huh.
reduce overall city costs.
It could be, yes. I think the key is the overall price point of the high deductible health plan would need to be
Right.
appropriate, right? Yeah. For the actuarial value of the plan. Yeah. Okay. This next slide's an eye chart. What all we're telling you here is we maintain tracking of the data that the state treasury uses to calculate the hard cap increase. And what we know is that the hard cap increase for 2027 will be 3.1%, which is about the average of what it's been. I told you it's been 2.7 over the life of the act. There's 1 month of data missing here for the calculation. We've since received that February data, and it leads to a 3.1% calculation. That'll be the hard cap increase for 27. Again, as I said, you all are currently opting out of Public Act 152 today. Now we get into the proposed amendment, House Bill 6058. This slide gives you a history. I think you all are aware that an amendment, House Bill 6058, was passed at the end of 2024 during lame duck. Through an administrative error, it was never transmitted to the governor along with 8 other bills. The year flipped. The House flipped, if you'll recall, from Democrat to Republican. The Senate remained Democratic. The Democratic Senate came to the Republican House and said, hey, by the way, 9 bills that were passed didn't make it to the governor. If you could please send those. And the House said, we didn't pass those bills. That was passed by the prior House, not our job, in essence. And so today, those bills still sit, never having been sent to the governor. The Senate elevated this to the appeals court. The appeals court ruled that the bills should be transmitted to the governor. The speaker then appealed to the Michigan Supreme Court. The Supreme Court has yet to take that case up, and it still remains to be seen if they will. If they do, will they agree with the appeals court? We don't know that answer. If the Supreme Court doesn't take it up, then the appeals court ruling stands. And then the question becomes, is there a legislative mechanism to force the legislature to do something? And we don't know the answer to that question. And then if the bills do reach the governor, would she sign them? And we don't know the answer to that question. So that's where House Bill 6058 sits. It's in limbo today. If it were to go into effect, as we talked about a minute ago, it would require public employers to pay not less than 80% of health insurance costs, whereas today you have the hard caps, or you may not pay more than 80% of health insurance costs. So it flips it from a ceiling to a floor, which is a big deal. It called for a one-time hard cap adjustment of 7% in 2005, and then it changed how that hard cap would be indexed moving forward. And the change is here in bold. It says any change in the medical care component of the average of the Michigan health insurance rates as approved by DIFs or by 3%, whichever is greater. It's a mouthful. I have to read it because I'm going to tell you this terminology doesn't even exist in our industry. I don't know where they got this language to write this bill, but the best we can interpret is the only thing that is somewhat peripherally related to this is health insurers in Michigan are required each year to file individual and small group rate increases with the Department of Insurance and Financial Services in Michigan. And so if we take the average of the small group increases that were filed for 2025 for 2026, that average renewal was 11.1%. So that would mean hard caps would have gone up 7% in 2005, another 11.1 in 2026. And we see those trends continuing. So we would expect another 11% in 2027. So hard caps that were going up 3% would now go up 11%. Is this connecting with everybody? Does this make sense?
Heck, East Lansing, because we've opted out.
Correct. In the world that you're in today, and you can continue to opt out. We want you to be aware of what's going on with in the hard cap world if this were potentially passed. All right. Looks like there's a question.
How do we stand on the 80% funding?
So that's a good question. Today, I feel confident saying you all are funding more than 80% of your health insurance program on behalf, and we could follow up with what that actual percentage funding level is. All right. So this is something we're continuing to keep an eye on. On the next slide, it shows you the hard cap numbers for single, two-person and family that were in place for 2025, the numbers that are in place right now for 2026. Again, you all are opting out, but if you were complying with PA 152, this would be what you could pay for single, two-person family. And then if everything went into effect retroactively, you can see what the numbers would jump to if House Bill 6058 were passed. If you total this up roughly, just based on an average group, these aren't East Lansing's numbers, but they would be somewhere in this realm. If you were complying with 6058, it would cost you about $260,000 more than current PA 152 per 100 employees. So with your 300-ish employees, it'd be about $750,000 in additional budgetary costs around health insurance if you were complying with the new PA 152 if it were amended. Does that make sense? Questions about that? It doesn't make sense.
How does the insurance go up? I don't understand how insurance would just go up by $750,000.
So if you are complying with Public Act 152, what it's saying is what you were capped at paying under the existing legislation is shown in column 1 and column 2 here. If you were agreeing to pay up to the hard cap, which a lot of public employers in Michigan have, then these would be the new hard cap values that an organization would be committed to paying up to.
Audrey, about how much does the employees pay?
Currently, employees pay nothing.
Well, they pay nothing.
They pay, the only people that pay are if you choose to have your spouse on the plan and they have an alternative coverage option, but you choose to have them on the city's plan, they pay $200 a month.
Okay, so the city pays 100% of the health insurance costs. Oh. Okay. Now I really don't understand how 3/4. I mean, the insurance is what the insurance is. I mean, the rate's not gonna go up just because there's a new state law saying what you can pay.
If we were using the hard cap, it would go up. We are
Right.
not using the hard cap.
Well, even if we were using the hard cap, if your insurance doesn't cost that much,
I understood. I guess the way to say it is your insurance does cost more than the hard cap today. All right. And so you would be bringing more money to the table on behalf of the employee if you were agreeing to fund up to these new hard caps. That's kind of the point that I was
correct,
making.
but they're not paying anything. So
Exactly.
we would not have an increase if this, okay, in our current status.
Your increase is really going to be more related to the pool increase of your
Correct.
rates because
Okay.
you're agreeing to pay
All right,
100%.
I got it.
All right. All right. So next steps with PO 152, I will just tell you this is part of our job as your consultant is to track issues like this and to keep your team apprised and to be planning accordingly as bargaining is taking place and those sorts of things. All right. And the last part of this, you all, is state of the market. And I think this is important to talk about. And I think this is part of your purview around the table is to say what's going on and what can be done about it. The number of commercial health plans in Michigan is shrinking. I mentioned McLaren, their commercial health plan going out of business. We're all aware that Physicians Health Plan that was affiliated with previously Sparrow Hospital, now Michigan Medicine went out of business. You've got commercial health plans that have posted double-digit or posted significant underwriting losses, meaning they're paying out way more in claims than they're taking in premium. So why is that happening? It's really happening for a number of reasons. We've got a slide that talks about what's driving the healthcare trend, and if I can go through that, we'll get to that for sure. It's the right question. You do have the continued consolidation of Michigan health systems, hospitals. If you look at this stat, Henry Ford, U of M, and Corewell make up 60% of the state's healthcare system. If you go back just 6 years ago, those systems, Corewell didn't exist. They were Spectrum and Beaumont individually. They tied up and became Corewell. Those hospitals 6 years ago only made up 20% of the cost. And when we have these health system consolidations, it's not what you would typically think, what we all learned in economics, that, you know, efficiencies drive costs down. When we see these combinations, what we see is a driving of anti-competitive nature, which actually drives costs up. All right. This is something we certainly have an eye on. This is a really revealing stat. In 2024, 47 cents of every dollar of premium that Blue Cross collected went to paying hospitals for medical care provided by hospitals. If you've been watching, GLP-1 weight loss medications were huge in the news, created a lot of very significant cost pressures for all health plans, not just in Michigan, but across the country. You can see the cost rose from 8.4 million to 100 million over a 3-year period. And the projections on those were just through the roof. Most health plans either excluded coverage from the beginning, or in the case of Blue Cross and the pool, they moved to exclude them in the latter part of 2024, all right, heading into 2025, because it was just creating unsustainable cost trends. That is one of the drivers to your question, and there were others for sure. There are a flurry of announcements from Washington, D.C. We won't get into those, but again, it seems like every day we're seeing a Federal Trade Commission ruling that affects pharmacy benefit managers or drug transparency. I don't think that's a bad thing necessarily. We need more transparency in healthcare, but also things like Trump RX and the Great Healthcare Plan. We're tracking all of those. And the significant changes for pharmacy benefit managers, I think this is an important one, you all. Every health plan, whether you realize it or not, has what's called a pharmacy benefit manager, or PBM. You all working with Blue Cross through the pool, Optum is the pharmacy benefit manager. The Federal Trade Commission ruling that I mentioned was against Express Scripts. And there were a lot of findings that came out of that and a lot of rulings of what ESI, Express Scripts, must do moving forward. And that is going to bring some changes to the PBM market that we're tracking very carefully, and we're hoping will help with some of the cost pressures in the pharmacy space in particular. Feedback on that? The next page is probably one of the more depressing slides in the presentation. These are average renewals for 2026, and you can see there were certainly large variations to these numbers. These are averages, but you can see Blue Cross, their preferred provider organization, fully insured, went up about 15.5% on average. Their HMO arm went up about 13.1%. If you're a self-funded plan, like I talked about, you buy catastrophic stop-loss insurance. That was going up an average of 17%. Administrative fees for self-funded plans, 2 to 3.5%. MESA, which is really more in the school world, went up 9.4%. You can see the pool went up on average 9.1%. And then you've got Priority Health and Health Alliance Plan in the same general realm, Health Alliance Plan being the lowest of all of those for 2026.
Are those higher than normal or about normal?
These are all, the trend is way higher. This is the highest trend that we've seen since about 2013.
Normally it'd be closer to 9 or 10 or something.
Yeah, healthcare trend had gotten down to the 6-7% realm, and we were seeing some lower renewals. Even if you go back and look at your historical renewals before 2025, you were in the lower single digits, but these pressures are real. And the next slide gets into the question of the why. We do have to go back, unfortunately, and talk about inflationary pressures that took place post-COVID, through COVID and post-COVID. In healthcare, we've seen a delayed impact of this. We've seen a delayed impact because if you think about hospital contracts, they're bargained for multi-years, oftentimes 4 and 5 years. And so hospitals had already agreed to reimbursement rates when that hyperinflation hit. Hospitals didn't have the luxury of saying, well, we're not going to follow suit with hyperinflation, with the supply costs that we're paying, with the wages that we're paying. All those costs escalated while their reimbursement stayed the same. And so when contracts reopened, what do you think happened to those contracts? We saw rates escalate. We have seen increased utilization. This is another huge driver of overall cost. A lot of this was pent-up demand from COVID when we weren't seeking care. A lot of later stage chronic conditions or cancer diagnoses, those sorts of things that maybe would have been caught earlier were caught later and at a higher cost. I already talked about GLP-1s. Tariffs, I can tell you healthcare underwriters were taking into account tariff activity when they were projecting future costs for importation of things like pharmaceuticals. Federal spending cuts on things like Medicare and Medicaid, as well as the Affordable Care Act subsidies. That does create a squeezing of the balloon effect, and it pushes costs over to the commercial insurance side. And then I did talk about underwriting losses that have resulted from this, and you're seeing carriers escalate rates to try to counteract those underwriting losses and take in enough money to cover these escalating costs. So it is a bit of a toxic cocktail right now in healthcare, just to be very genuine. I know this is not shiny news. It's the real news, though, and it's what we need to talk about.
Well, the pieces associated with the postponing related to COVID come back down?
That is our hope for sure. And it's our expectation, but we do expect a rough ride here for a bit yet as this works its way through the system. I imagine you all have seen the communications between Michigan Medicine and Blue Cross and the disconnect in the negotiations right now. And it depends on whose story you believe. The truth probably lies somewhere in the middle, but that is a great example of how we're still seeing the catch up. Henry Ford and Corwell had already done their contract negotiations with Blue Cross. Those are settled for a time. Michigan Medicine is open right now, and the same things that happened with the others are now happening with Michigan Medicine. Those costs are going to work their way through the system. It's why you're seeing Blue Cross push so hard to try to maintain some level of sustainability in the market as you all are continuing to see costs escalate for your plans, as are other employers. Is this helpful?
Why, so you thinking 3 to 5 years?
I think that's reasonable. I think what we're seeing right now is some of the trends come back into the line. What's concerning to us is last year in 2024, Blue Cross posted about a $1.2 billion loss with a B, and they just came out with how 2025 ran. They cut some operational expenses, but their losses were still above 900 million. So they've moved the needle a little bit, but as those losses continue, that concerns us about we're still riding this out. That's what that says to us for the near future here. Okay. Did you tell them this was going to be an encouraging message? All right. So cost trends. This actually goes back to 2025, second quarter. There is a lag with this data working its way through the system, which is why this is a little bit aged. This shows you Gallagher's analysis of healthcare trend and what actually happened. For total medical trend, we were projecting 8 to 9%. The second quarter of 2025 came in a bit lower than that. But for pharmacy, you can see we projected 14 to 15. It actually came in at about 15 to 16%. And over on the right-hand side, it dives into a little bit of the specifics of what's driving these numbers. Your top conditions by spend in the medical side are cancer, musculoskeletal issues, so knee replacements, hip replacements, back surgeries, circulatory issues, so think certainly cardiac in that, digestive, and then injuries. So you can see the percentage of spend and how those costs are trending. I apologize for the formatting error on the RX part of this table. You gotta with your eyes shift those trend numbers down one line. I apologize. But what you can see, Mounjaro and Ozempic, those are both GLP-1 medications designed to treat diabetes. These drugs didn't exist 5 years ago. And now look at their top drugs by spend. Look at the trend number for Mounjaro, almost 70% trend, meaning increase cost year over year for health plans. Humira, on the other hand, and this is where you got to shift the numbers with your eyes, that negative 23%, this is an encouraging sign for us. What this is a signal of, if you've heard about biosimilars, biosimilars are alternatives to high-cost specialty medications that have the same biologic ingredients that the brand name specialty med has, but they're able now to compete with a brand name specialty medication that's come off patent. That's why you're seeing the trend number on Humira go down. As more biosimilars come to the market, we expect that to be a help cost-wise. And then Stelara and Wegovy round out the list, Wegovy being a GLP-1 for weight loss. Noteworthy that it's on the top 5.
Excuse me, is
yes,
there any
please.
experience that would indicate whether you're getting a savings by the use of those weight loss drugs?
Yeah, this is a very popular question, and this is a very difficult, it's a very difficult question to answer. This is what I will tell you is where we are in the timeline of GLP-1 weight loss medications hitting the market and the studies associated with those. What we think we know today, and it depends on what study you look at, is there is absolutely a marked reduction in weight with the GLP-1 medications. We see a correlation, we think, with a reduction in things like hospitalizations, stroke, heart attack. The challenge is the overall cost of GLP-1 utilizers as a group compared to non-utilizers. There's still not an overall savings to justify some of those health benefits. Now, you can find studies that say the opposite of that. That's where I'm saying we're in the early stages, and I think there's a lot more data that needs to build up. Ultimately, right, wrong, or indifferent, the industry saw the cost trend and said, we can't wait long enough to see the impact. We can't sustain these cost increases and the increased trend to find out if it's going to work or not. Does that make sense? All right, a few more slides and I'll be out of your hair here, you all, and I'm happy to entertain any questions. What should we expect next? We do expect this market volatility to continue for the next few years. You can see the pharmaceutical spending increase up 50 billion with a B in 2024, and that trend is continuing. Stop loss insurance trends, and then the Medicare, Medicaid cuts and the Affordable Care Act. So we talked about all of these things. Do we have capacity for a few more slides in terms of what we can do about it? Yeah, that's really what this is. It's the, oh, do you want to skip forward across past know your data? Okay. Nope.
Most of that pharmacy increase from the weight loss drugs then?
It's a large part of it, but it's really specialty medications in general around things like multiple sclerosis, for instance, gene and cell therapies. There truly are treatments. They are curative in nature, but they can cost $1 million, $2 million, $3 million for the course of treatment. These were things that the industry just never contemplated, 60 years ago, right? 20 years ago. Yeah. So when we talk about, we give you a couple examples. If we can just go back one slide real quickly. This slide is an example of how you can involve the workforce, the consumer population. This is you and me too. We're healthcare consumers. And what this program does is it deploys nurses that are engaging with complex, folks with complex health conditions and helping them navigate the complexity of the healthcare system, helping them find high quality, lower cost care, making sure that they have supports and really leveraging partnerships through organizations like Mayo Clinic to manage these conditions. In some cases, there may be another healthcare program that they're qualified for, which would actually give them better care than their employer health plan. And are they aware that they're eligible for that? All of these things, you need to be self-funded to do this program. I will tell you, this is a type program that the pool is assessing for its members to help its members achieve more value in their access to healthcare. So that would be an example, things like this. The next slide, direct primary care. I don't know if this is a familiar topic or not with you all, but direct primary care, essentially what it says is the employer pays a subscription for the workforce to have same day, next day access to primary care at a centralized location. There are examples of municipalities in Michigan who do this on site, near site. And really the thought process here is if we can get folks engaged with primary care, will they be in a better position to manage their health, have help managing their health, right? And can we catch things earlier in the process and hopefully avoid later stage diagnoses, those sorts of things? And can we cut some overhead around simple things like generic drugs that could be dispensed on site or lab work? Could we avoid referrals to specialists that could be handled in a primary care setting if that primary care physician had more time with the patient? That's the philosophy around this. Now, there is analysis that needs to be done with this, you all. This isn't a slam dunk that says, if you do this, you're going to cut your healthcare costs. But this is a trend in Michigan that we wanted to talk with you all about, just because we know some of your colleague municipalities are doing that. We're not endorsing this idea. We're saying this is an idea we're positioned to help the city explore if they had interest down the road. And then direct primary care, or sorry, direct contracting. This is the concept we talked about earlier in the presentation. I stole my thunder from this slide, but this is where you do partner with a self-funded third-party administrator to establish direct contracts with hospital systems at deeper discounts than what the carriers are doing today. And you're incentivizing, you're directing care, right, to higher quality, lower cost provider settings that are hopefully driving better outcomes. That's the thought process here. I think I already fielded questions on this, but questions about direct primary care or some of the navigation resources that I referenced? Okay. And then additional pharmacy news. This really summarizes some of the things that I made reference to. We are hopeful around some of this legislative change, you all. There is a lot to work out through the system. But between the Consolidated Appropriations Act, Department of Labor proposed regulations, and then this Federal Trade Commission settlement with Express Scripts, what you'll see running through all of this is a drive toward more transparency in the pharmacy space, more protections for us as the consumer. One really interesting element of the FTC ruling with ESI, Express Scripts, is the requirement to recognize direct-to-consumer drug purchases, meaning if you or I goes direct to the pharmacy manufacturer to get that prescription versus going to the pharmacy benefit manager would have to recognize our out-of-pocket spend as spend under the health insurance plan. Today, if you use some of those discount programs, GoodRx is another one, for example, a coupon program, you and I as the consumer are spending those dollars out of our pocket, and it has no interface with our health insurance plan. So it's simply added out-of-pocket cost for you or me as the consumer. This would require that out-of-pocket cost to be recognized as part of our out-of-pocket spend. That it'll be interesting to see how some of these things work their way through the market and if we see it drive actual reduced cost for pharmacy. So this is really the way we partner with you all at the city, and we partner with your administrative team and your union and non-affiliated leadership, is helping you all be prepared. We're in the midst of these expensive healthcare trends, and you all being with the pool is working to address these healthcare trends and to bring added components to that program to help hold down costs for their member organizations and their employees. I think the benefit you all have is they're continuing to operate at the lowest overall trend of really any player in the market right now in Michigan. So it's a benefit that you all are a member of that organization today. Building with an eye towards sustainability for sure. Looking for those efficiencies like we talked about. I will tell you all, when cost trends are like they are in healthcare, there is never a greater time for sales pitches to come out of the woodwork and land on your desks and other desks. There's not many days that go by that I don't have a client reach out and say, hey, we heard about this program. What do you know about it? And we spend as much time explaining to folks why they don't want to pursue an idea and kind of the hidden agendas with those programs as we do talking about these would be good proactive things to do, just to be very genuine with you. And again, we're alongside you as your subject matter experts in this area to help you be anticipating and trying to get at those costs. That was a lot.
Question for Audrey. This would be advanced algebra, and I'm not sure how to do it. But have we ever done the analysis on since you have this flexible spending, what the savings in Social Security would be if we moved some of the costs to the employees? You know, because that comes out pre-Social Security for both sides. Okay. Yeah, because there might be some number where we could save enough on Social Security that they could pay it in. Do you understand what I'm asking? I mean, the employees doesn't pay anything. If they did, it would be pre-Social Security on their paycheck. And the employer's half would also go down.
You're saying that because the employee contribution for health insurance would be pre-tax, is that?
Pre-tax is pre-tax federal tax and it's pre-tax Social Security. Okay, all right, thanks.
Sorry, I know I'm late to the presentation here, but I did have a question involving one of the things you had in the thing. You had 20% of members equals 80% of the costs, which is a pretty significant number. Do we have any breakdown of that 20% of the members by age, by sex, by, any kind of category that can let us examine our workforce to determine where our costs are really associated?
Yeah, so again, probably the place that I'll start and is always most important is we look at things on a de-identified basis, first of all. Second of all, we do regularly review claim utilization data and analytics with your administrative team so that you all can understand the conditions that are present within the workforce. We look at that for, first of all, to assess risk level and to project likely future cost. But we also look at it to identify trends to see if there are opportunities for a point solution or point of education to where we can get at some of those disease states from a preventive basis. And so we do have those breakdowns. We look at the population from a demographic perspective and also from a claims utilization perspective.
Can those be shared with the financial health team? Lori, are you on that administrative team? The administrative team he's referring to that takes a look at healthcare costs on a periodic basis. Okay.
Which data would you be sharing? Sorry.
When we do claim utilization review with you all, looking at overall plan utilization, top conditions, top drugs, those sorts of things.
Yeah, those are all communicated at our quarterly meetings.
But not to us,
To council?
no, to council or to the financial health team.
Oh,
I'm
but
not-
we
my
haven't
question
discussed
is,
it. No, I mean.
Can they be shared with the financial health team? Okay.
Correct.
It's de-identified, and I apologize for deferring, but I just don't know the
No,
the mechanics.
That's fine. And the administrative team that you're referring to, I think we created back in the early 2000s when we started to see like a real push upward in an attempt to work with our labor unions. Are members of our unions participating in these? Okay, great. That's all I want to know.
Are sharing that, and I apologize for clarity. When I refer to administrative team, I'm referring to City Manager Bellman, to Audrey, to Emily, the HR and finance and HR teams. And then the task force we are interacting with as well and sharing that information
Great.
from an educational perspective, for sure.
So one other question. If we had a program to improve employee health, example, an incentive for people to quit smoking, financial incentive. If they take it and we get less smokers and therefore our experience improves, is there a financial benefit to the city?
Well, right now you're paying 100% of the cost, so there would absolutely be a dollar for dollar benefit. For any, let me,
We're paying through the pool, right?
you are, but you're paying 100% of those health insurance premiums. And so if your health spend went down through health improvement programs that had an effect,
Okay,
then your premiums would follow that utilization, right? What the pool is charging you, because they're setting your rates based on past utilization, like any health plan.
they
would.
set rates for individual cities or individual units?
So they have an average renewal. They priced you originally based on your specific data, because they do price each individual group based on their risk profile, because they need to take in enough premium for the services that are going to be
Sure.
consumed, right? And then your renewals over time, they're comparing your performance against the pool average performance. And if you're using more than the pool average, that's where I said you'd be adjusted more than the pool average. But if you were performing better than the pool average, you would actually get a lower renewal than the pool average renewal. And that's where I'm saying I think you all absolutely would benefit if you were able to improve the overall health risk and overall health of city employees and their dependents.
That would go back to your question about breaking it down. Right.
Have you offered those in the past? Does any long-term employee know that?
What's that?
Have you offered something like that in the past?
I don't
Well,
think.
I mean, has the city offered it in the past?
I'm not sure about that particular incentive. We have worksite wellness things where we do, if you meet these, exercise goals or wellness goals, you get a $50 gift card. So we have lots of different programs like that.
Is it unusual that a municipality is paying 100%?
I mean,
I didn't know that anyone did that anymore. A little.
I think it does still exist in the municipal space because you all have the ability to opt out where some of your other public sector counterparts cannot. They don't have the access to that provision. And so we do see it. I wouldn't say it's common. We do see it, but I wouldn't say it's common.
And that's not like a forever thing. Employees were paying up until about a couple years ago when we switched to the pool. And because the rate changed, we got a better rate with the pool. Then we still met the hard cap, and without employees paying. These next two rate increases, that's why we've had to opt out, is because that did kind of leap over that hard cap, but the mix of the rates at the hard cap for the single double family didn't quite make sense to be able to charge employees. So we're looking at that as kind of a slow re-implementation of that.
Fred, established formula that will go into effect, or is it something that you're gonna have to rebargain for, or?
Because all the unions participate in the healthcare task force, if we agree to it, then we agree to it. The group agrees to it, then the union membership doesn't individually get to bargain for it, but, that's a conversation that still has to be had.
But it wasn't something like the city was paying $1,000 and and the employee was paying 30 and it went down to only 900. And so the city just kept paying the whole 900. If it ever went up to 1,000 again, that 30 would go into effect. That wasn't the formula or
No,
anything like
that wasn't the
Okay,
formula.
all right. Anybody have any other questions? It's a really big number. For both the employees and the retirees, so. Well, thank you.
Thank you for having me.
Yeah, and this is really for the chair, but as part of the report of the financial health team, a recommendation with regard to any change here would be valuable for the council to consider. And I'm not sure whether you have a recommendation as to how we should be looking at this, but I think if you share that with the financial health team, that would be very beneficial to us. Okay.
The next item is the DDA and TIF presentation. You're just gonna do all three right in a row, or?
Heather's gonna do the other one.
Okay.
So
All right, okay, thanks.
my name is Lori Mullins and I'm the DDA Executive Director. And I have been here for about 6 weeks, but I did previously work for the city, so have actually a long background here before that. So I'm just gonna jump right in with DDAs are enabled through PA 57. They were originally. Sure. Okay.
I'm gonna talk about 3.3.
All righty, all right. So, yeah, so downtowns matter. They're the center of our communities, and that's why the Downtown Development Authority legislation came about, was to help stop deterioration of downtowns, but also to provide a sustainable funding mechanism for reinvesting in those downtown areas. And so they focus on revitalization, economic growth, and property value enhancement. And DDAs are funded through tax increment financing and other revenues. So the next slide shows the different revenue sources. With our DDA, we have tax increment financing, 3 different specific TIF areas. 2 of those have TIF collect tax increment revenue, and the third only does the millage, which was the second box there. We have a millage that's throughout the DDA area that's about 1.65 mils, on top of the normal millages that other properties in the city are subject to. The special assessment is an option for DDAs. Our DDA does not have that, but we have a downtown management board that has a special assessment for promotion of businesses. And then we can do revenue bonds, revenue from rental of DDA owned properties, and grants and donations, and we've done all of those and have those ongoing. The next slide has the DDA tax capture millages, and you'll see here that it's 36.8952 mils that's captured within the DDA district for DDA activities, and approximately 16 mils of that is from other jurisdictions, and then you see that 1.6462 mils in there that's just on DDA properties. Sure.
So I was playing around with the property tax for the city. And I came up with a number that was significantly higher than what Audrey had built into her base, which they then explained to me the difference was the capture that was going to the DDA and a couple other things. And that was about 2.7 million. Is that ringing a bell? So we have 2.7 million going from city operating millage to the DDA and 2 other items. All the TIF. That really is my question. When we take 2.7 million out of the city operation budget under tax capture, does it go to all these or just the DDA? Or help me understand the distribution of that 2.7 million.
Right, so the funds that are captured for the different TIF districts go to all of the districts that we're going to talk about here. Now, what this slide is showing is all of the different taxing jurisdictions that are contributing to the DDA itself. So, so if it weren't for the DDA, if we didn't have a DDA, then the 16 mils that's associated with the county and CATA and the airport authority, those would all be going to those different taxing jurisdictions instead of being
It would be
captured and kept here. Right. Yep. Okay. So, any other questions on that?
How much of the DDA millage is being captured?
So,
Gotta be substantial, I would think.
do you mean the dollar number or the?
I'm kind of thinking the dollar number.
Yeah. So in our budget, then, for revenue overall, then we have, it's a total of, it's about 2.77 million. That's
What's on the 36?
That's actually for everything, but it's only for the DDA. So I think that the number that you're talking about is what from the city is being.
Property tax that was showing on the 5-year forecast of 16 something.
Yeah.
Multiplied it by the 12.5362 mils for city operations, and I get about 18.8 million. But Audrey's only showing about 16.6 on the 5-year forecast, and I understand the difference to be what's going to the DDA and the other 2 entities that I don't remember. that didn't include 36.8952 mils.
So ironically, the number that you're talking about and the number that I'm talking about are similar, but they're different things. So the 2.7 million that's DDA capture is all of these different taxing jurisdictions, what they're foregoing in order to have a strong downtown East Lansing
I
DDA.
only multiplied by 12 mils, not 36 mils.
The other number would be what would be going to the DDA, all of the brownfield plans and the LDFA. So, so there's those three that are collecting the city portion of
What are you getting off of 36 mils?
about 2.7 million also. It was the number I just said, it's 2.767 mils. I'm not, sorry, not mils, million.
And that includes the millage, tip one and tip two.
Yes. Yep.
Off of 12 mils, you get 2.7, and off of 36 mils, you get 2.7?
Different areas, different properties. It's just ironic that they're similar numbers. It's a coincidence. But that's the amount that's coming off from the DDA properties for all of these different,
Do you have a
what,
similar slide?
I don't know.
Isn't most of the DDA in a TIF?
Most of it is, there's an area, that is from.
So so you're capturing almost all your millage money.
Well,
The DDA
Yeah,
millage money is being
so-
almost all captured.
so the base was set on the first area in 1986. And that's the area where the University Place, the Marriott office building and Marriott Hotel, that was set then. So with the taxes that were captured before that was built are still going to all the taxing jurisdictions. And then it was expanded and, in 91, and that area, what was the base at that time, is still going to all those taxing jurisdictions. All of the inflationary increase after that is going to the DDA, except for the area that's east of Collingwood. And that area doesn't have a tax increment revenue capture. It just has that extra millage.
This has the extra, and that's really the only place that
Right. So
the rest is being captured into.
except for, I mean, I'll add
It's okay.
a little caveat
It's okay.
here is that, when we've had brownfield plans in the DDA, then we've done an interlocal agreement where the DDA has said, we're gonna forego the new tax revenue in order to help this project happen. And that way the brownfield authority captures that to pay for the brownfield eligible activities that are part of the brownfield plan. So some of that part is being captured by the brownfield authority and being used to reimburse for those eligible activities.
So you're getting very little on the DDA millage. That's coming in directly. The rest is coming in through the capture.
Most of it's coming in through the capture, right?
All right.
Yep.
Okay, thank you.
The next slide is current DDA initiatives and priorities, and we have all sorts of projects that we're using our revenue to pay for, including safer sidewalks, lighting projects. Well, in this upcoming year's budget right now, we have $320,000 anticipated for specifically
We
for
have
sidewalks.
3 sidewalk programs, 2 through the Department of Public Works and then 1 through you.
I don't know about the other sidewalk programs. I know that what the DDA is looking at doing is making some improvements specifically around safety on sidewalks in this coming year.
And the DDA.
We have some lighting upgrades. We have public restrooms that we're working on adding. There's a facade improvement program where we're helping individual property owners with facade improvements. There's efforts around increased engagement and promotion of the downtown. We have municipal service agreements also, and so this is an important aspect of the budget. So DDAs are allowed to enter into contracts, and some of these contracts that we enter into are with different departments within the city. And so there are funds that are going directly to DPW through a municipal service agreement to fund maintenance efforts in the downtown. We have funding going to the police department. We're working right now, we've been funding different aspects of the police department, like overtime charges, but new recently is 2 dedicated officers to the downtown and a portion of 1 social worker's salary. So having some of those very dedicated services in the downtown are things that we're contracting with the city on. So those are some important aspects of the budget. And then, yeah, go ahead.
Question as a downtown resident. Are both of those police officers on the night shift or some on the day shift or?
We're anticipating that in the budget right now, we still have the overtime, which is really for night shift activities. And then the 2 new officers, which haven't been added yet, will be throughout the day. And we're anticipating that being more of the community policing and, just visible officers on the streets during the day.
Talking about that, I don't know if this is an Audrey question or not, but in that 5-year forecast, you had fully funded the FY 2026 folks that hadn't gotten hired yet, assuming they'd get hired in 2027. Do these 2 folks, are they part of the FY 2026 or are they on top of the 2026 new folks?
They would be on top of the 2026 numbers.
Not showing in your 5-year forecast per se, because they're being paid out of DDA.
Well, the expense would show in the 5-year forecast, but there would also be offsetting revenue from the DDA. That being said, I think the fire or police chief has said they have other positions to fill before they're gonna fill these positions. So we may not have the full impact of them included in the 27 budget because they may not be filled in 27.
Oh, no, more vacancy savings.
Yeah.
But these, actually, there were 2 for traffic violations.
Correct.
Okay,
Correct.
and those are on top of the FY 2026.
Correct.
Whatever, I can't remember what that FT was. Fully, but those FY 26 are fully funded plus 4 in your 5-year forecast.
In the 5-year forecast, yes.
And the last slide is just my contact information. So I'm happy to provide any additional information if additional questions come up after today.
Sorry, I don't know anything about the DDA laws. Who created the DDA? City council or the state or?
The state, yeah. So it was created in 1974, I think I had in there, or 77. And it was recently changed. It's PA 57 is the current enabling legislation, which is the TIF Consolidation Act, which made more reporting requirements and some other things, but yeah, it's a state program.
You have to have a valid plan in place to spend that money or you cease to exist?
Yeah, you have to have a plan. You have to follow the plan and then do reporting on how you're implementing your plan. Yep. Yes. Mhm.
Want to clear up, so it's a state statute that authorizes the city to establish a DDA. So the state doesn't establish a DDA, the council has established a DDA.
Thank you.
But I want to ask you, what percentage, if you know, of that $2.7 million is then brought back to the city through municipal service agreements that we have?
850,000 in this coming year's budget is what we're anticipating. So percentage wise.
About a third comes right back to us. And then one question, no, we don't have a tip on the eastern portion of it, but when we established that, it was a requirement that any money raised in that area be spent in that area. And is that still the policy of the DDA?
It was during that time when they did that, is when all the improvements on Grand River were being done. And was when all those improvements on Grand River was done. And so the DDA or the city loaned the DDA funds and the DDA paid through that capture.
Got it.
Yes. Yep. I just want to add one thing also. So there's TIF one, like Lori described, which is the Marriott, and that TIF is captured for the underground parking garage that's beneath the Marriott. That's a city-owned garage. And back in 2014, that we renewed that TIF, and it's a 79% capture, not 100% capture. So there is 21% that go to the taxing jurisdictions. And it was at that time, we extended the TIF because there was debt taken out to do technology and infrastructure improvements on that garage. So that money goes right back to a payment. So those funds, I think it's about 140, go towards a debt payment every year, and that'll take place until 2034.
Did Bellman do something related to that garage? The park rating?
As part of the deficit reduction plan, the city-owned garages, they established a lease rental rate that the parking fund pays to the general fund. So that's on city-owned garages, but then as parking is a third member of the condo association. And so when the municipal agreement or the agreement between the city and the Marriott expires, that condo association would also pay the city an annual lease, of which the parking fund is a third participant, and then there's the two external condo participants that would also pay the city.
You want me to talk first about the TIF guideline policy? Is that, okay, yes, it is. And Councilmember Meadows, you may not remember this. You signed it. So back in 2017, the city established guidelines for approving TIF. And this was related to the DDA and the Brownfield Redevelopment Authority. And so I won't go through verbatim what it says, but it just points out that though projects capturing less than 100% of the TIF will be preferable. And they're looking at, things of for brownfields for cleanup, contamination, obsolete buildings for reimbursement on those as approved brownfield plans to capture that TIF. And for the DDA, again, is for economic development, job creation, and public infrastructure improvements. So there's a guide that the city established at that time for those. Did you want to add anything?
Well, I'm hoping that you can explain to everybody what TIF is, because I think almost everybody doesn't really understand it. But we decided as a policy that we would be willing to provide tax increment financing for environmental cleanup and public infrastructure. So even with the development on Albert Street, the new parking garage that took the place of the surface lot, yes, the total cost of that I think is somewhere around $53 million over a 30-year period with the interest on it. And people think that might come out of your pocket, but that isn't how TIF works. And so in that particular instance, because that's public infrastructure that met our policy, the actual cost of the parking garage was something like 23 million or something like that. And it basically what happens is you as the developer pay your taxes directly to the city, which collects taxes for all these other entities as well. We have 100% capture on all the other entities also. So their taxes that they pay are the only thing that we use in tax increment financing. So you build the garage for us, we capture your taxes, we hand your taxes back to you using your money to pay our debt on the garage. And that's how that functions down there.
At the end of that agreement, who owns the garage?
We do. We own it now. So we own that garage. And that's our property. And above the garage is, an annual lease of the air rights to have that senior apartments up there. And at some point, we own that as well because it's our property.
Oh, is that a possible avenue for the Hannah Center?
I mean, to
Have Satifa for the Hannah Center?
I don't know the answer to that. And I think that's one thing that you guys are going to take a look at because what could happen here is it become part of a recreational authority. And which the public would have to vote to have a millage on that, but that is another way of.
Does the
dealing.
public have to vote on a TIFA or does the city council vote?
City
on it?
council does that.
Build this building, I'm gonna hire 800 employees. The only thing you would offer them are a tip or a brownfield.
Based on where they're located and if it meets the eligibility.
Right. Anything else incentives would be from a state program. Okay, thank you.
I'm sorry, is your microphone on?
I'll repeat exactly what I said. All right. If somebody comes in and says, I'm gonna build this big building, I'm gonna hire 800 people, the only incentives the city would offer, as you said, depending on where it was, are a TIF or a brownfield. Any other in business incentives they would have would be through the state.
Correct, with the exception of, there's been projects, but it's been several years where we've done, property tax abatement for so many years, like, companies coming in and they're investing a whole, some expensive equipment, but they're bringing employees in. The city has done that. I think the last one was on a project out on West Road, and I'm drawing a blank on the name of it. But I think that was the last one, and it's been several years.
Has it expired or is it still, I mean, how many of those do you have out there?
I think
That
there's only one but there is a PILT, payment in lieu of taxes that was awarded to
Oh, okay.
PK about the low cost.
Oh, for
Low
the,
to moderate
yes,
income,
that would be the other, yes, a pilot, payment in lieu of taxes for, which keeps, housing affordable in certain projects. Yes. Yes,
Something unique about Avondale that you guys were involved in?
yes. So, we purchased the houses, in that block, with the exception of one. And what we did is we took a loan out against our community development block grant dollars that we receive. We're an entitlement community. Federal government recognizes us as a entitlement community, so each year we receive a grant. And we use those grant funds to support affordable housing, infrastructure improvements in certain neighborhoods that qualify as being CDBG eligible, and then public service activities like Haven House providing funding for those. So what HUD allows you to do is to take a loan out against those future entitlement grants and then put you on a repayment schedule. The city. Yep, the city. This is totally separate. Yep, so this would not be the DDA. So we took a $1.8 million loan to purchase demo, help get the site ready. And then we also created a brownfield where we capture some of that tax revenue to pay for the public infrastructure improvements that were necessary, water mains, sidewalks, sewer, those types of things. So it even, because one thing I should clarify, DDA has a district, brownfield is city boundaries. So a brownfield plan can be anywhere.
So HUD allowed you to take out a loan.
Mm-hmm.
Cap on how much can be taken out?
Well, it was based on a pro forma that was prepared on the project itself. So we took a $1.8 million loan and we paid it off about 4 years ago. So we no longer have that payment. So HUD each year would say, here's your $500,000. And then we would say, okay, and then we would go through a process and have to return to them a payment of $130,000 or whatever it may be that year. And then what we started doing is they allow you to pay ahead, if you want to pay it off early, you can. And so we did that. We seen that as more of an advantage.
But when you did that, was that taking other CDBG money away from other things that would have qualified? Or was that on top of what our normal allotment would have been?
So it's just part of our normal allotment. So so we didn't do maybe as many, park improvements or sidewalk projects or things like that during that period, or we funded them, but they were at a reduced amount. But that was all worked out ahead of time with the, like with DPW and that and city council of how that would look and how that may impact some of those other activities. But now we're back to fully funding, parks and sidewalks in eligible neighborhoods. Yeah. Yeah. Okay. Brownfield? Okay. Okay, so Brownfield Redevelopment Authority under Public Act 381, established in 1996, allowed the city to form a Brownfield Redevelopment Authority. Our Downtown Development Authority also serves as our Brownfield Redevelopment Authority Board. So they're one and the same. So the city established our Brownfield Authority in 2000. We have 11 board members. We've approved 20 Brownfield plans since 2004. Our current year budget, we capture about 3.6 million. We have 12 active plans and we require some of our brownfield plans we are able to capture an administration fee for the work because there's reporting and other things that have to be done. And so we capture this current fiscal year that we're in $81,000 from those plans. One thing that's unique about Brownfield and DDA is they work together. As Lori stated earlier, the DDA will forego the capture because they're capturing the same millages. So for example, Park District where the Abbott is in the Graduate Hotel, that was a Brownfield project. So the DDA and the Brownfield entered into agreement, which the DDA says will let you capture that until that plan's completed. We reimburse the developer and then it goes back to the DDA. So that plan ended in fiscal year 25. That capture did for the Brownfield, we reimbursed the developer. So that plant's closed and now the DDA captures those funds. So that's why they did, if you look at their budget from 25 to 26, you see that increase. And it was mainly because of that. And then just the increase in values.
What's your fund balance on your DDA most recent year? How much is that is committed?
Fund balance,
Aside something for payables, receivables, all that stuff.
well, yeah, so the fund balance is on top of what's committed, so, the
All uncommitted at this point.
only caveat I would add is that right now we still own the Evergreen properties. And we're looking at selling those for less than what we owe on those.
I
And,
thought you'd already did.
well, we have a signed purchase agreement, but it hasn't closed yet. And so, when that closes, then we'll still have about $1 million that's owed on those properties. And so, I don't anticipate that the DDA will decide to use its fund balance for that. I think that it'll probably be paid off over time, just continue to be debt. But that's one reason that it's been really important to have a healthy fund balance is because we have that debt that the DDA has been relying on the fund balance to pay for.
Do you usually increase that fund balance every year or decrease it, or it's variable?
It's variable. Like Heather said, we've had the brownfield plans roll off. And so this year and next year, we're anticipating adding to the fund balance, but that hasn't always been the case. Thank you.
So, next screen. Okay. So these are a list of our current, brownfield plans. I will point out, you go down the left-hand side, the fourth project the third project, West Village Phase 1 through 3. That is within the DDA. So the DDA and the brownfield have an interlocal agreement, which allows the brownfield to capture those funds. And that has several years left on it for reimbursement for the developer. Albert Place condominiums. So the Albert Place condominiums, there's a parking ramp attached to that. And when that was built, there was a brownfield plan for that public infrastructure improvement. And that plan is going off. There'll be a partial payment in fiscal year 27, and that plan will go off. It'll be closed off. And so those funds, again, will go back to the DDA. You see. So I don't have a fund balance.
Just constantly going back and
Yep,
forth.
and it's based on a capture, the treasurer tracks all of these. And then we work together to ensure that there's eligible costs so the developer can be reimbursed each year, so. St. Anne is another one, that's within the DDA, and so there's a interlocal agreement. This still has a few years left on it. And 565 East Grand River is coming off this year. It's ending, or it has ended. This fiscal year, we have Costco, which still has several years. 1100 Trowbridge, has probably one more full year and a partial year left. And so when that plan ends, the funds will just go back to the taxing jurisdictions because that's not within the DDA. And then Center City is, what we were just talking about, the other Avenue parking garage and that has substantial debt on it. And we're capturing that to pay back the debt on that. So those are our current plans.
For all of the captures, is there a year where it's gonna be substantially less, where they fall off? Do you know?
The next few years, I mean, beginning from fiscal year 25, probably over the next 5 years, we have probably we've had a couple plans go off and we have probably 3 more. So there will be that, yes.
So she said it was 2.7. It could be going down each year for the next few years.
No,
It's 7.
most of it'll
No.
go back to DDA.
That's DDA stuff.
Oh, I'm sorry.
That's okay.
That
So,
was the well,
yeah. So brownfield, what happens is,
well, just a second, what?
The 12 mil, there is some going to the brownfield. But I don't think
Yeah.
it's a large amount.
What is the overall,
Yeah.
what is
Here.
the overall capture amount for everything, Audrey?
Andrea.
Andrea, I'm sorry.
I don't have that number just off the top of my head,
But
but it's much more, the number that Robbie, you're looking at is much more complicated than just taking the captures off it. We also have pilot program that we have to take that number into account and reduce that off. That value has to be, because of new state law, when I pull a tax roll, the assessing roll has to have the full value of every property in the city. And that is going to take into account, things that can't be taxed. So pilots have full value of their properties.
Pilot.
A pilot is a payment in lieu of tax. So it's generally like senior living communities or things that have gotten in agreement with the city to pay a lesser amount versus a tax. So instead of taxing them at the full 12.5362 rate, they're getting an agreement with the city, which I think we have 4 at the moment, that they pay a percentage of their rental value of their subsidized housing. So they send me an audit of their rental value. I look at their audit of what they say they could rent for the year, and they pay a portion of that amount of money. And so although if you were to look at our value of all the taxes in the city of the homes, we should get X number of taxes. Well, we have to back out the value of all of those properties that are under pilots because they aren't paying the true taxable value times 12.5362. They're paying let's say they should be paying I'm just giving this as a general estimate. The one property should be paying $2 million worth of taxes for everything, but they're really paying $400,000. So it skews it, and I have to do a lot of calculations to back out things. So when you're seeing in the forecast, you're seeing a number I had to do a ton of back end calculations to get to, which involves pulling all the capture districts out, pulling all the pilots out. We also have to 425 districts where we owe them some money for properties that we tax for them. So there's some calculations in that too. So it's not as simple as I can just say, yeah, that number, we can calculate it out and it will exactly match up. So that's kind of the hard part. I can show you the spreadsheet and give it to you. Yeah, but that is why you can't exactly match up what's on one page versus another.
Do PILTs expire, pilots?
They do have a time frame. It depends on the contract that was set with the specific project. So
Can you two together kind
Yeah.
of give us a projection on what you think the captures are in the next few years so we can see if it's gonna go down a little?
she would have to look up when their eligible costs are done.
Yeah, that's what I mean. I
Mhm.
don't mean the second.
No.
I
Yeah.
know, for the future, so we
Yeah,
can.
I have estimates,
Yeah.
and again, it depends on the value, so for example, the Park District project was supposed to be a 9-year capture because the value was so high, so we could the capture was high. We ended it in 6 years.
Yeah.
And so you just don't know, it just based on the value. There are some,
Yeah,
So,
because it's
yeah.
it's either a time limit or if they
Yeah.
hit the eligible cost. So it's one or the other, whatever comes first. And if the value of the properties is going up, which it had been for the last few years, plans were ending much sooner than they were anticipated to do. So if values which are starting to come down a little bit are not increasing quite as quickly, I would say, not coming down per se, they will stretch out a little bit longer than they had been.
And we don't need some in-depth thing, just
Yeah.
a rough
again,
estimate.
yeah, I can give you a rough.
Mhm.
If over the
estimate.
next 3 years, there's an additional 500,000 or whatever it is, just so that we got some feel.
Yeah.
Okay.
Now, when they end though, if they're in the DDA district, the money will just transfer over to the DDA. It will not be coming back to the city. It'll just be captured by the DDA if they're in the DDA district.
Yeah,
It'll
the-
sit in their fund balance.
Because the interlocal agreement says that when a brownfield ends, the DDA is now able to capture it. So the city operating tax will then go directly to the DDA.
Okay.
So if the brownfield is within the
Yep.
DDA district.
Okay.
So, and just, you had a question about, the amount, so our current, this year, the current budget, the capture is approximately 3.6 million. So that money's being captured and then I reimburse it per plan, and then that, I think it was 81,000 I showed on the first slide, that the admin, the city gets to keep that money as part of the admin, but the rest is reimbursed to the developers. There's always something unique. State education tax, there's Plan 18, 20, 22, and 24, when they were approved. The state had changed it, so if you were capturing the state education tax, you have to return 50% of that. So we're capturing it, then we turn around and we send that back to the state. So that's another unique.
I mean, the savings to our capture, the city's capture, when I said,
I'm sorry?
when you do this analysis, the reduction to the city's capture, not the overall capture. How much, the city's 12 mills. Yeah,
Right.
okay,
Yes.
yeah, I don't,
I'll work with
if
Andrea.
you're saving the zoo, you're saving the, yeah, we don't need those. We want the savings for just the city. Okay,
Okay, so, let's go down. Okay, so this is what the brownfield TIF captures. So you can see, there's always something unique. Casco, if you recall where it's located, we capture the Hazlet sinking just on that project, but this is the mills and what we capture, and as you can see, it's the same as the DDA. I'll go to the next slide. So this next slide is an actual example of what Andrea prepares for a brownfield capture. So this is for Center City. So this is the project that includes Target, that includes the parking garage, all of those new businesses along, the new, businesses along Albert Avenue. So there's the taxable value, there's the base value, the percent that's captured, and then the captured value. And then she goes through and she inputs each of those millage and it calculates out. So for this summer capture, it's a little over 2 million. And for the winter, it's 325,000. And that money goes directly back for debt payment.
But only 436,000 impacts the city.
Correct. And so if this plan was to end, the DDA would get that. Yeah, get this.
A future issue, I might add,
Yes.
so.
But several years. Yeah. Okay. What else did I have here? Oh, and then I'm showing you, so then what happens is twice a year, using the information that Andrew provides me, I go through and I prepare, the, capture, deducting some of those things. So the total capture was $2,023,469. The city captures 15,000 for admin cost of that. We return 50% of the state education tax. I deduct that out. So our net due to pay that debt payment, we sent a payment of 1.9 million to pay on that debt payment. And so I'll be starting this next week. The reimbursements for winter are much smaller because the bulk of the taxes are captured. Those millage rates are captured in the summer. So this is just an example of one.
But if I can add one thing, that just like the park project, the value of the property has increased substantially. And this is about, I would say, almost $500,000 more than we calculated at the beginning of the project going to them every year. So the time frame for that is shortening dramatically. And then one more thing that you probably should know is that in all of our agreements to acquire property and double the size of the city, in virtually every one of them, individuals who are already living there continued to pay only their township taxes. So we don't, all of the increase that we may have had and anything that we might have had for a millage that was higher than the township millage, those properties for those people who still live there and were living there at the time that we entered into those agreements, those 425 agreements, they're paying their township taxes, not ours.
What happened?
Property sold. They're on our books, okay? And that has happened substantially because Hawk Nest is about 438 houses fully built out now, but there is turnover there consistently. And I don't think anybody is living in there right now who was living in there at the time that we acquired the property. Hawk Nest, not Hawk Hollow, so.
But Hot Nest, I thought was brand new versus.
There were some people living in there at the time because the developer was constructing a trailer park.
Questions on Brownfield? Okay, great. Talk about LDFA. So the LDFA is organization that was created that includes the City of East Lansing, City of Lansing, Ingham County, and Michigan State University. And there is again, a TIF capture, very minimal though, it's a lot different than some of the others. And the idea is to capture those dollars and reinvest in high-tech companies, entrepreneurship, and other types of businesses. So we have, there's 13 board members. There are 3 East Lansing representatives who serve on the board, including Councilmember Meadows. And the fiscal year 26 capture is $952,610. And so in the agreement with that, those captures of those dollars, the city of East Lansing gets to keep 10% of those funds for the administration of the LDFA. And then the LDFA is, receives the balance, which this year is 857,000. And again, this year when we started out, last year at this time, when we were preparing, the estimate of the capture, it was going to be more like $550,000, but due to some brownfield plants coming off and some other, just the, increase in value, it substantially increased, and we actually just this past two council meetings approved the amended budget for it to allow to show that increase in how they're going to spend those dollars. So the LDFA, so there's an organization called LEAP. I don't know if you're familiar with LEAP. They actually manage and staff the LDFA, which oversees the Technology Innovation Center, which is referred to as our TIC, which is located on the 3rd floor of the building at 325 East Grand River, right above where the old Jacobson's department store. It's on the 3rd floor of that. And that was something that was created actually by our Downtown Development Authority back in 2010, maybe? Earlier with that?
Yeah.
But no.
Maybe?
2007.
Oh, okay. And so some of those dollars go, some of these funds go to support that, the TIC, and then other activities.
How do we measure whether TIC's been successful?
So job growth, job creation, also the companies that come out, that spin off out of the TIC, out of the Technology Innovation Center. So the TIC is set up for entrepreneurs who are starting out with a new business plan or a new business idea. They have shared space. At the time when the DDA created, it was like a 2-year program. They could spend 24 months there. Their shared office space, and the idea is that the overhead is kept down, which gives them the opportunities to focus on growing their business there.
Businesses have been created.
I don't have an exact number, but it's a lot, actually. And this has been beneficial probably before, I want to say, before early 2000s. MSU was not an entrepreneurial university. In other words, they didn't encourage their professors to create and then move off and market. And so when the LDFA was created, which I think was 2005, it just happened. I was the first chair. And that was before we did anything. So I didn't have any responsibility for making it work. But after I had left, it started to ramp up, and MSU became more entrepreneurial. The TIC is, the space available in the TIC is largely full of new businesses that create in that space and then move off. So I don't know how you grade the success of it, but we're trying to become a center for sort of the modern technology that creates jobs in a different way than we used to, non-manufacturing activities. And I think we've been successful in doing that. Our only problem, if there is one, is that the authority to operate or obtain money to operate the TIC expires in 2027, and we're working right now to extend that 15 years at the Capitol. And I think there's support to do that, and that will happen. The other issue is that our partner, Lansing, doesn't provide any money for it. So we're the sole funder of this.
Did MSU provide funding?
MSU through the foundation is a very big supporter of the project and has provided space and funding over a period of time. And LEAP is a contract. That's a contract with them. We pay them to operate the organization. And one of the things that we've demanded with regard to this is that any money that goes into this organization from the city of East Lansing must be spent in the city of East Lansing. So we're in the process of changing the bylaws there to make sure that that is going to happen, and that's a condition of our support for this extension of time. So I keep you informed. I'm sure we'll have it all taken care of before the financial health team is finished, but we can provide some more information too. That might be more detail for you.
It's working, that's fine.
Need to provide a report, an annual report, and we can get a copy of that.
Well, it's not much money, but, you know, a few 900,000s and we got a problem solved.
I believe one of the students
Yes,
who did something with
Shoelaces.
shoelaces
On Shark
just
Tank.
got a Shark Tank deal.
yes.
Like just in
Yep.
late
There
January.
was someone, one of the first successes was a student who created a software program where and worked with a number of corporate businesses and had their gift cards all on one site. So you could go to one site and pick the gift card you wanted and was able to move on and actually sold that company and started another company. So we've had some successes over the years. So.
Yeah, I should mention that 2 of the East Lansing members are here because Heather is also on the board.
I was just appointed.
And I had to resign to come on here, so you really have three.
That's why I got appointed.
Are there incentives for the businesses that are launched to stay in East Lansing?
I don't think there's a incentive there, but we have, I'm not exactly sure how much space we have, but essentially what we've seen more recently is that if you're moving out of the TIC, you're moving across the street to the Marriott office building, and you're operating out of a little larger space, but again, somewhat subsidized so that we know, and we're trying to, build it so that you feel anchored here. Yeah. So I don't know how successful we've been at that, but I can try to get more information for you.
Yep. Any questions? Okay.
Thank you.
You want to go over her presentation, or was people going to watch the videos, or what were we thinking on that? You want her to do the presentation?
I will not be doing the
Oh,
presentation.
okay. Okay, so do we know where to get the video, or?
Sure, yeah. So
Okay.
it's on the city council's website. Yeah, and I think the original email even had a timestamp in it for the council meeting. Yeah.
Oh, I didn't know it was, okay.
Yeah.
Okay, was there some specifics on the adopted to actual?
That was just a request from Robbie.
Okay,
Providing that.
all right,
information.
and then we're gonna meet to go over Robbie's questions. We already talked about that. Okay, so we had some questions. I mean, anybody have anything? Okay, yeah, I encourage everybody to watch that video. I haven't either, but I'll encourage everybody to watch it. So we're gonna talk about debt, the current debt, and then the where our limit is, but I think our limit's quite substantial, but.
So this is from our fiscal year 25 audit.
What is our capacity and?
So this is our taxable value. 10% of that is obviously this amount. And then this is our current debt less revenue bonds. So we have capacity of 156 million.
that we're not using right now?
Correct.
$156,875.
So would you take that and spread it over 20 years? I can't be 156 each year.
That would be the issuance, like the outstanding debt. 20, I would say, yeah.
State only allows you to have debt at 10% of your SEV. So we could only have 173. We only got 17. So we have lots of room to issue debt. Doesn't mean we want to.
So-
Sometimes the municipality is limited by this, so that's why we wanted to talk about it. This isn't a case here.
So I'm sorry, if you take the 156 and you put it over 20 years at, I don't know, pick a percent, 5%, 6%, what's a typical annual payment on that then?
Would have to come up with some numbers. I don't know.
Or whatever numbers made sense to you, given today's market. I know nothing about this.
I think maybe this will be helpful is, council was just presented some options to bond for, a total of $1.4 million.
Out of the 156?
Correct. And then with an additional 913,000 for if like Hannah third floor was gonna be included in there. And so then this amortization schedule shows you these first two columns are the without Hannah third floor, and then over to this side is if we had Hannah third floor. And then different time periods, so 20-year, 25-year. And so bonding for 15 million, the same 15 million, or adding Hannah third floor is 20 million. And so then those are the annual debt payments on a
Sorry,
20.
I can't read those, so can you give me a,
670,000 for 15 million over 20 years. Going up to topping out at $1 million.
so if we did that, let's just use this as an example, then we wouldn't be funding a separate, well, a small cash capital improvement program, because you're buying computers and all that stuff you can't bond for. But we wouldn't be doing a cash capital outlay, we'd be doing this instead.
Correct. This would combine several different projects and bonding for all of that.
I'm sorry, is that hooked to the city council meeting, or can we get this in a?
This is on this meeting's agenda. It was discussed at the last discussion only meeting.
Yeah, we had just a brief discussion. I would just say that the content here, some of the things that we've talked about were originally presented, like for instance, with regard to Hannah, were presented at a Parks and Recreation, budget meeting or discussion. I think at that point in time, everybody was kind of looking at this as a general fund item, and we were looking like poorly at that because it was such additional money from the general fund. And the suggestion was made there to look at bonding, because these are infrastructure improvements, basically, almost like every one. These are an operational cost of any kind. In the late 90s and early 2000s, we instituted, I think they were 20-year bonds. They might have been 15 we built the aquatic center and the soccer fields and the softball complex, all these infrastructure improvements, and renovated Hannah Community Center into this beautiful building that we have now, and the library. Anyway, all of those bonds have expired at this point. So that's one of the reasons we have like a huge amount of money available to borrow if we choose to do that. But the other thing to remind yourself of is that this is not a payment that is going to, well, it might come from the general fund because of a tax that is imposed on our citizens, but this is tax money that would go towards. We would need to raise taxes in order to make the payments on this.
Well, maybe. I mean, that's part of what we're discussing, right?
No, you would be making, if you made a recommendation to bond for these items, and we're gonna take a look at that anyway. There is, this type of bond, as I recall Robert mentioning, unless there's a petition by citizens within, I want to say 30 days of an enactment by the council, it would just go into effect. We haven't done anything like that previously. I don't think we'd be doing it this time. This would probably be something that would go on the ballot for the people to.
But your other choice besides raising a tax is to cut something else in the budget to make these payments.
To do this work, I would look at it differently, to go ahead and do all of the things that are part of the proposal sitting here right now. These are infrastructure improvements to Hannah, the resurfacing of the parking lot at the aquatic center and the softball complex. I mean, you can go down the list, and the question for the public would be, do we need to do this right now? Or can we wait to do this? And that's one of the issues that, everybody's going to be talking about. So,
What would you be waiting for?
and how long would you be waiting for?
No, what would you be waiting? Where's your trigger if you say we need to wait? What trigger you?
I mean, it depends on, what the public's appetite is for whatever we're proposing to do.
Go back
I
to.
mean, if you're willing to live with, one of the former employees of the city who worked in Park, he said, hey, the best traffic calming is a crummy road with a lot of, potholes in it. So if you're willing to live like that in your parking lot up at the aquatic center, then you say, we don't want to pay for that right now, so.
Environmentalists would argue we ought to have less porous materials anyway. But my point, I mean, you talking about raising a tax to do this, if we found ways to cut the budget to move this money forward to be able to do all these things,
That's another
okay
way.
too, right?
That's another way, yeah.
Debt schedule. There's 2 more years in that first column. Debt is the general obligations, the first column.
Yeah.
Is thought that would just go back in the pot, or
Pardon?
we just start saving that money, right? That would be a savings to the general fund in 29.
I'd have to see which one that is. So general government, it kind of crosses different funds, but, maybe.
So there may be a savings in that.
Yeah, that's in our debt service fund, which the general fund directly
Pays for it.
pays for. Mhm.
On this new one, there would be a debt service millage for it. Is that the thought behind it? And do we know how many mills that would be? Is it in the
That-
letter?
I don't think that was discussed, in the memo to council. I guess I interpreted what, Mr. Bellman said differently. So I didn't realize that he was saying that without objection, that it would just become a debt millage. I didn't realize that that was the.
Okay, can we get clarification on that and what the millage would be?
Who approves the capital outlay list? Like, who put the parking lots for, I don't know, the Patriarch Park or whatever it is? I assume the directors put on things that they think need to be done. Is there a public hearing on that?
As part of the budget process, there is a public hearing. And so any capital that's part of the budget is available to discuss that public hearing. I don't believe there's a public hearing on the CIP plan itself.
I think actually planning does have they have a public hearing before they, annually, there's a capital improvements program required to be updated, a 5-year program. And so what you can guess is, and it doesn't always happen, but the first year, the number one is what we should be doing this year. And so there's a variety, all the departments put out anything they think needs to be done that year. And then planning takes a look at it, the planning commission, and then makes a decision on the.
Planning commission?
Yeah, so it's a public process, so.
Did you put these debt payments in your projections?
Then the ones that were just discussed, no.
So your 5-year forecast does not include the first year of capital outlay?
I'm talking about the
Debt.
debt. I was talking about the debt.
Oh, I'm sorry.
No,
Does it include the first year of the capital outlay plan?
yes. Well, no. I mean, the forecast is that hadn't been finalized when the forecast was developed. So there will be more capital in the budget than was in the forecast. Not at the moment, no.
Do you have any other questions? Thank you. All right, we talked about updating this study on MSU. And finance made some calls and well, it's in here. I'll go over it in a second. The person who did it last time, the person who did it last time did not want to do it this time. And so they called 5 groups. 1 had no response, 2 declined. One of them was $30,000, but they need to maybe look at the scope more. And then there's this range between $40,000 and $100,000. That's a big gap. So it seems like, pick a number in the middle, but so I'm not sure we still want to do it.
Well,
It's
I'm
on here
sorry,
to
I
talk about.
couldn't make it last time because my wife had surgery and I ended up holding her hand afterwards. I wondered why we wanted to do it in the first place. As an engineer, I never run a test unless I know what I'm going to do with the result.
Well, we kind of ended up there.
Right,
Mitch Bean did it back in 27. And he came up with quite a bit that particularly our first responders were doing for MSU that wasn't getting reimbursed. So that's where it started. And then, that was done, better than, 2017? Is that ringing any bell?
Yeah, it would have been 2017, and it was, of course, we have a member here who's Mitch's partner, and who put that together, Robert Klein. So
So then the thinking was, did we, Jill, I think, would argue that we're doing the income tax now, and that kind of compensates more.
I think it was instrumental in helping us get the income tax, having the study before.
Well, let me say, I went back over the study that was done before. And the thing that stood out to me was the discrepancy between the the population of the city and the total population that we're serving. In other words, and what I did, and it's getting passed around, is I just did a summary of the universities in the state-supported universities, their enrollment, and the population of the cities that they're in. And the upper graph shows the enrollment, and it's sorted in order of largest to smallest. And you can see that U of M and MSU dominated. It's really interesting if you look at the graph below, which is the ratio of the enrollment to the city population. And it shows how high we are relative to, MSU is,
They exceed us now.
it's enormous. Yeah, it is. And it really has, and you look at Big Rapids with Ferris State, and it's another case where the university is bigger than the city. And it really is creating a situation, but Ferris State is, much, much smaller than MSU. So then I started looking at it and I said, okay, and I'll pass this one around too. If you take MSU as, for lack of a better term, the elephant in the room. We had a $3.75 million net cost for MSU for the public safety and DPW back in 2015. The state revenue at that point, based on sales tax, was about $79 per capita. If you look, the sales tax revenue from 2015 to 2024, which is the last one I had, was about a 35% increase, 35.8% in the state. So, and that was roughly equivalent to the CPI index. So I said, okay, CPI has gone up about 5.4% from 24 to 26. So you look, the sales tax revenue for 26 would be, say, 25 or 5.6% above what it was 2 years ago. So just, ballparking it, that means an estimated per capita revenue sharing increase to $113. Now, Mark, that may not be accurate. I mean, the legislature may have done something different, but I'm looking at it and I'm saying, okay, so if we took that and the MSU enrollment was 51,838, the revenue sharing for an additional 51,838 residents would be 5.86 million a year. Even if you just looked at the 40% of the students that are in university housing, it'd be 2.34 million a year. That's a lot of money. That would make a big difference in our deficit. And so I would recommend that we push the legislature to amend MCL 141.903, which defines the population of a city to include either the full amount of students in public universities or some fractional amount. And if you look at the summation of all these universities, you've got about, 200,000 students versus a Michigan population of 10 million. So even if you increased all of the university cities by that amount, you want copies of these? I've got extra copies if you want. But even if you increased that amount, it would probably only result in about a 2% decrease for other cities. And if you simply took the students that are living in university housing, it would be far less. So I think it's a rational thing to do. And the only thing it would require on the part of the legislature is just to add a statement in to the that MCL that defines the population. And there's already a statement in there that subtracts from the population people that are incarcerated. So it's a parallel type thing. I think that's one thing that we could really push for through our representative and, you know, senator to try and get this done.
Have any feel for what it would cost the state in total?
Nothing. Nothing.
You would take the same amount of money and spread it differently?
That's what they're doing, isn't it? They take a certain percentage of the sales tax revenue
But you would have
and they
to,
distribute it.
you would have to subtract these 51,000 students from the cities that they're coming from.
You
Or all
could,
the out-of-state students,
you
they're
could.
not really counted, right?
Well, there are people that were providing
No,
services.
I absolutely understand, but I just think
I'm just
they would
saying.
say that's
you-
too much.
And that's
math.
why I said, you could look at, you know, for bounding it, you could either have the 51,000 or you could go down to 40% of that, which is roughly what's in the dorms.
Right.
I mean, those are realistic numbers as to what the burden we're bearing for all of those students. And, you know, if you look back at that, what was it? 3.75 million, and you increase that by the amount that the CPI and the per capita stuff has gone up, it's probably 5 million. So now if we, you know, it's not an unreasonable thing to ask.
And you're not even gonna charge us for the study, huh?
Yeah,
Somewhere.
I work cheap.
4,000 and 8,000.
Yeah, I know. I actually, I kind of like the $100,000.
I,
But no, we've got the information. And but it's kind of a logical thing to do. And when you look at the ratio, you see that East Lansing is really getting hit relative to other. I mean, Ann Arbor has a population of what, 122,000 now, 123,000. And it's about the same size school. So
along the same line you're thinking of, I was thinking of PA 289 for the firefighters. I'm not understanding why we only show $1 million in there when we know it's more, and I'm wondering if we're unilaterally disarming ourselves when the other universities are figuring out their share of the 289.
I don't know what they're doing there. And you can argue that the 289 share should be in addition to the per capita one, because the universities have a huge capital investment there that we're protecting that doesn't reflect their population.
Maybe
So,
we should put them both in and make it one.
you know, if we gotta go for one, I'd go for this one. Yeah, I mean, what do you think? You were on the legislature, come on.
Well, I can tell you that we've had, numerous discussions with regard to 289, because it, depending on, well, it actually didn't depend on what party the governor was from. That was always something that we had to struggle to obtain. Because that's one of the first hits. There's a budget issue at the state level, they start to erode local money.
Well, it's an enormous number.
Yeah.
So they look at,
Well,
But we clearly, we have a station on campus. At one point, we have taller buildings now, but at one point, a lot of our equipment was purchased because we had 11-story buildings on campus. We needed equipment that we didn't use within the city proper, but we needed in order to provide fire safety on campus. And not to mention the fact that none of the dorms had fire suppression in them at that time. So all that's been retrofitted now, which is good for every university in the state. But yeah, we could look at all this stuff. I think that this is one of those things where where the committee should want someone to come in to go get into the sort of the weeds on this and what is available, how it can be done. Yes, we could go down and we can ask, Samsung and Penelope and to go ahead and introduce some legislation to move this or move something like this. I think there's work that would need to be done prior to that time and maybe through the MML, the municipal league. But I think this is sort of a long range change that we're looking at because it doesn't happen very fast at the Capitol, I can tell you.
There's the
But it
same
makes
amount of
sense.
money in the pot. And so if these college towns got more, other people are gonna get less. And so MML, I'm not sure it's the right group to pursue it through.
Well, you know, if we engage other university communities,
Yeah.
because that's whatever, we've got 31, I guess, public universities. But it's not just public universities, it's where private universities are located. University communities have a big caucus that operates at the Capitol. Each of us has their own lobbyists, but I think there is an opportunity here that's worth taking a look at. That might be one of your recommendations
Yep.
or recommendations, and we could have somebody come in to talk about the process.
And, you know, if you have a total pie and you're trying to divide it up, you could certainly give back to, or, you know, give back to the communities where, you know, maybe we say, okay, students are here 75% of the time. For those who are in other communities, you know, you take 75% of the per capita away from them, each student, I don't know.
Well, they would retain their population, so they would theoretically get their same amount of money out of it's the pot that would shift, but but Act 289 is really I think the thing, because we have a significant amount of state-owned land within our community that we're required to provide services to. Even when you think that the university has its own police department, you know, really, we are across there constantly. And so 289 that's been the area that we've sort of fought over for a number of years, and I think we've been in pretty good shape most recently. But not always, and usually when there's a downturn, and we may be looking at one on the horizon right now. That's when they start to grab that 289 money back.
So 289 is a statutory,
Statutory, yep.
but there's also constitutional.
There's,
289 is the firefighting money, right?
well, it's the services to state-owned property.
It's not the revenue sharing.
But
it.
there is the revenue sharing one is the one that they brought up as $79 per capita.
Right.
And that's a broader use. And, you know, whereas we can look at specific things like firefighting or police or whatever, we wouldn't need to justify it based on that. I mean, we have more people in the city than we are being credited for in the population estimate. So
My concern would be, let's say this is $10 million we're moving from them, split it to everybody to these college towns. If half of that comes from Detroit, that's gonna be the hard sell. That's what we need someone to help.
it's not, Detroit is 650,000 out of 10 million.
I'm talking about, you know, if their cut is shorter because of that.
They would get more.
I don't mean because their students are coming here, I'm just saying because the pot got smaller. That's the math that we'd have to work, yeah. But that's the concern that, you know, if we're taking a pot and we're pushing more towards other sides, somebody's a loser in this.
There'd be more losers than winners, so it would never pass.
Yeah.
Cause
Not that I don't think we should look at it, but
well, why are we gonna help out East Lansing and Ann Arbor? Like, who cares? And that's what I would say.
It's small, it's not worth it.
I think we'd be better off trying to push legislation to allow cities or municipalities to tack on like a 0.5% sales tax. Like, you can't do that here, but like I lived in many other states where you can do that.
Yeah.
The sales tax is different from county to county.
That's
'Cause-
still, my point is that's still a change in state law.
well, that's what I'm saying. If we're gonna go after legislation, like, let's do that. Cause everybody would get behind that. Cause Detroit would be like, hey, now we can start taxing it. Like, that would be more likely to get traction. I
You
think.
really think a tax increase would have a better chance than a small redistribution?
I think so. I don't. If I'm a student and I live in, say I live in pick a town. Say I live in Lansing and I go to East Lansing. Are you gonna subtract me from Lansing and add me to East Lansing, or are you gonna count me twice?
Oh, I would count you twice. And my argument is that the percentage of, the total percentage of students is so small relative to the state population that it makes a de minimis change to the revenue sharing for the other cities, especially if you go down and you just count the ones that are housed on campus.
Yeah. But then people say, well, they're only on campus 8 months out of the year, 9 months out of the year.
Okay,
But I
so you
like
take
that-
9 months out of the year and you cut it down.
Sure.
So now you're cutting, instead of 2.3, you're gonna take 2.
Yeah.
I'll take 2.
Well, if the study was like, hey, Jackson is now gonna get this much money instead of this much, and it was not a lot of money. And it was like that for every city, now we could maybe get some headway. But like, just in theories, I would be like, well, I'm not gonna give up my money so you can get more. But if I was like,
But when you're
$5,
talking 2% or less, you know,
but I would imagine every city is like us and we're like groveling for all the money
When
we would
they
get.
passed 289, why did they only include fire and not police?
Because they weren't doing anything for fire prior to 289, so that, I mean, they were trying to deal with the issue. I just note that our projection for 2026, which I assume we've already gotten the budget somewhere, is our total statutory and constitutional revenue sharing will be $6,712,404. And that the following year, the total is $6,599,685, so 2027, so.
Looking at the state estimates for Ingham and Clinton.
I'm looking at the report on revenue sharing that was issued by the state. So,
Is the one that's broken down by county?
yes,
So are you just looking at Ingham?
I'm in Ingham and I'm looking at East Lansing.
There's also Clinton is also, I
Oh,
was
yeah,
saying,
good point. I forgot about that.
it's a much smaller number, but
But I think that the issue that you might run into with sales tax, it's a regressive tax. It affects people with less money more significantly. And when we've had that discussion at the Capitol, which, you know, would have been almost 20 years ago now for me, but you know, that was the pushback. And it was significant, like a significant pushback. You know, organizations that worked with lower income individuals, you know, came out in pretty big force. So that's what we could anticipate with something like that. I think that's the reason, you know, the state has, you know, for the longest time, not had a local sales tax permitted. It's always been a single tax. And yeah, we're different than a whole lot of other states in particular, where you might have a 7% tax in town A, and then you go and get a motel room at the next one, and oh, they have a 12% sales tax. So the predictability of what we pay has been, you know, relatively important.
we have a motel tax.
I think there is a motel tax. I can't tell you what it is.
There's no hotel.
Yeah. Yeah, but we get our portion of that. So
Right, back to the study. I recommend we do not move forward with the study.
I second that.
Okay, any comments on it? We do not move forward with the MSU study. That's what's on the table.
Well, would it make sense to look at the one from 2017 and kind of, because I mean, it was a while ago. Yeah, I mean, like as a group, like,
Yeah, sure.
yeah,
Okay,
I know things have changed, but.
yeah, right.
yeah, and have we looked at the RFP, what we were looking for there? Because if it's updating an existing study, even though it's 2017, I can't imagine it being as expensive as they were pitching at us. So
Matt made the calls.
What would that change?
that would be, you know, there are whatever significant changes have taken place in it. You've got a document you're already working from. So.
It'd give you something to give to your lobbyists, but whether it would move forward is
Yeah.
unknown.
Do we have lobbyists?
What's that?
Do we have lobbyists?
Yeah, we have a lobbyist.
You?
No, we hire, we have a,
Jeff Mattel
and then-
did.
yeah,
Oh, okay.
it's really Maureen Watson who does that, but yes.
All right, Matt's gonna tell us what.
I was just gonna comment that when I did reach out, I did kind of preface it with an update of the current study, and those were the numbers I got back. So it was essentially update what we have existing and what's your price, so.
All right, there's a motion on the table to not move forward with it. All in favor, say aye. Okay. All right. The last thing is, these required versus the MERS contributions. Yeah.
You had just asked for the numbers
Can you
really.
explain me the columns, how it,
Yep, so this is, contributions to the pension plan for each fiscal year. Blue is the required contribution here. And then supplemental, but the two red columns are what make up the supplemental. So general fund, or it was grant funded through, fiscal year 2024. And then when the income tax came into play, then we started reducing the general fund contribution once we exceeded 5 million supplemental. For the most
So,
recent year.
explain to me the math on the 25 then. I mean, I don't get to the 14.
So the required plus the 5 supplemental is 14 total contribution.
And what, and then the 6 million? The 66 million? The 6.6 million? Sorry,
Oh, sorry, 26 must have been,
there's just an issue there.
yeah, I mean, these are estimated numbers anyway, so I
Okay,
think the form is what we've actually submitted
Okay,
thus far.
all right, so that, ignore that year and we can see the rest, okay.
By the way, I went looking for your 11 million that we could take OPEB unfunded liability off the table. I couldn't find it. When I was playing around with the 5-year forecast, I was hoping to find 11 million.
Yeah, I know, but could we borrow for it? That's the question. How would the debt conservative, if we could get rid of paying for a retiree, take it out of the trust and only have a short debt service, that's something to look at.
Yeah, oh, yeah.
So, I mean, there's something there. I don't know what it is. We have to get there, but there's something there that could lead to some kind of savings, I think. Oh, I love the next item. on the agenda. Okay, now our next meeting. One of the things I think we need to at least look at is authorities. Is the option of a fire authority an option? Is the option of a parks authority? I just don't know how you go about even starting that process. So I think our recommendation would be if we could get the city attorney here to maybe give us some basics, step-by-steps on how that would work. I mean, obviously, once we knew it, then we could talk about what municipalities you'd add or how it would work. But, I don't know, or I haven't been able to find anybody that even has the basics of the steps that would need to go into that. So does that make sense to everybody? It would be an additional millage.
Yeah, we need to be real clear up front.
Right.
That's more tax.
I understand, but it's one of the things that we should look at. It's one thing I hear about all the time is, cooperation, and maybe it would reduce overall overtime. Maybe it would save money by combining enough that it would make it beneficial to do it. So, I mean, Mark, do you think the city attorney is the person to start with, or?
I think you could start with the city attorney, and obviously finance plays a big role in that, because it really is about, once we would understand the sort of dynamics of it, which generally I think with a fire authority and a recreational authority are both like 1%, 1 mil is the maximum, maybe, that, you know, what would be included and what would be the impact of that kind of money on the general fund, because it would peel that money out in terms of you can use recreational authority money to operate. So I'm not sure what the impact would be. And likewise for a fire authority, you know, would there even be an appetite for it? Our likely partner there would probably be Meridian Township or Bath. And I'm not sure what that would impact. If the recreational authority, we've talked about doing that with the school district as our partner in that, because the school district and the city have an agreement related to our purchase of the area that the aquatic center, that was school district property, and the softball complex. They get to use those as part of an agreement that we had on those. So they're our partner on those, and they use Hannah quite a bit as well. So if you took those properties that are utilized by them, we would also gain taxation within Meridian Township, which would add some revenue to that number. So anyway, I think it's worth taking a look at. I don't know the answer as to whether you would recommend anything on that, but there are probably a number of opportunities for authorities. Water and Sewer Authority we have one in existence, which seems to operate pretty well for us. And I think it's worthwhile taking a look at. So the city attorney come in, and then there may be somebody that can point us to who could give you even more detail with regard to that.
The other thing that's been suggested to me, and I'm not saying I'm supportive of it, but we should look at it, is maybe some kind of a dollar surcharge or something on athletic tickets, because of the huge cost that is to the city for those events. Don't know if it's legal, don't know how you go about it. So I think that would be the other thing, if we could ask the city attorney to look at and see what the options would be on that. Go ahead.
Yeah, and I might add, you know, you might want to take a look at other sorts of dedicated millages. You know, if the senior program had a dedicated millage, would there be a positive impact on the ability to spend other money elsewhere, things like that? So.
Knowing what these property tax bills are, it's hard to think about any kind of additional millage. I mean, but well, it's our jobs to look at everything. Everything's on the table, but you know, some of them. So if we can invite the attorney to talk about those two items, is there anything else we want to ask? If is it a he or she? He or she is here.
Assuming it would be Rosati, but I'm not sure. Or, yeah, he.
Anything else we need to spend some more time on?
I'm starting to feel like we've collected a lot of info, certainly a lot of pages.
Yeah.
I feel like we're starting to reach the point where we can talk to each other.
Yeah, I think the homework part's done. We've done our homework and it's time to move forward. Hopefully before the next meeting, probably not. When is the next meeting? The second? Okay, we won't have met to go over Robbie's questions. Yeah, because I'm not here next week and she's not here the week after. So that's one thing. When we come back, we'll do that. And I also want to say, we're going to try everything in our power to not have to cancel another meeting. There were staff that couldn't make it. Mr. Gallagher gentleman couldn't come. So we tried everything moving around the agenda and we just couldn't get it to work. But we're gonna try our best not to cancel any more meetings. I'm sorry about that one getting canceled, but we tried our best. We just couldn't work through it. So I think our next meeting, we'll have the attorney here and then we're just gonna do a brainstorming session. Let's get everything we think's a possibility on one list. And then we'll go there, take them one by one. But everything we've heard so far, you know, the street light assessment, the $1 a ticket, whatever the items are we've thrown out. Let's get everything on the list. And then we can work from there.
Just aren't interested.
Correct,
So we can focus on that.
correct. And that mid-report's gonna be due. Is it mid-April or the end of April?
As I said at the time, they wanted to do that, you can just say, we're working on it, so.
Well, I could say, these are the things that are under discussion, but
Well, I
if it's mid-April, I'm gonna have trouble getting it done.
very loosely in case something gets taken off.
Correct. Yeah. Okay, so I think that's gonna be next meeting, city attorney, and then brainstorming sessions to get a really good list of everything we have. Anybody have any other suggestions?
Can I suggest one other thing, which would be maybe a deeper explanation of this proposed bond that,
Oh, yeah, that needs to be clarified. Is it a bond issue and what the millage is? And are we just I assume the millage is just on the general fund part and the parking's gonna pay their part? Cause it looked like you had 3 funding sources for it. Yeah, just how that whole thing's gonna work. I think we need that clarified.
I did have one question, Audrey, I think for you. MSU laid off some employees last year. Does the income taxes reflect any of that? And also, will there be any impact on property taxes due to property values from anything that might come from federal funding changes for the university?
No changes for property taxes from federal funding. That all still stays based off of, the values stay what they are. Millage rates are what does that. The values of the homes may change based off of just general market values. Your income tax question, we don't have any of that information yet because people are just now filing for 2025. So we won't have any of that data until much later in the year. So they're just turning in their returns for 2025, and we can't speak specifically on any certain person or business or anything, so we can't single out MSU when we talk about anything with income tax. But just in general, if any large community business or something laid off a lot of people, there would be some slight decrease. But with that little amount of people, depending on how much their income was, it may not make that big of a difference.
So you haven't seen people selling their homes and leaving the community or not moving here because of
We've seen people
changes?
selling their houses, but they get bought immediately. So I haven't seen anything vacant. I've seen many, many homes being sold and purchased right away. So, yeah.
Thanks.
Yep.
Remember, on the income tax, it's 1% if you're a resident, 0.5% if you're a non-resident. So it takes a big number to make a difference. Yeah.
What might make a difference is all the non-residents that are working remotely, if the university pushes them to come back to the office. That would be a big deal. I told Kevin that.
All right, anybody got anything else? I didn't think we were gonna have a long one tonight, but. Denial or something. All right, well, thanks, everybody. No. All in favor?
Aye.
Thanks.